This subcommittee will come to order. The chair will recognize himself for an opening statement. The Community Living Assistance Services and Supports Program, the CLASS program, a government-run long-term care insurance entitlement, was included in last year's health reform law, seemingly as part of a budget process to make the law look less expensive than it really is. Since participants will have to pay into the program for 5 years before becoming eligible for any benefits, CBO estimates including the CLASS Act in Obamacare reduced the 10-year cost of the legislation by $70 billion. With CBO estimating that the CLASS program will begin running a deficit by 2030, and CMS's own actuaries estimating that the program will go into deficit in 2025, a taxpayer bailout may look very attractive to future Congresses when premium increases and benefit cuts can no longer make up the shortfall. While Obamacare specifically prohibits using taxpayer funds to finance CLASS, Congress can always pass a new law to allow the practice. Additionally, Congress can redirect funds from general revenue into the CLASS Independence Fund if it needs to. The concerns about this program are not limited to Republicans. In October of 2009, Senators Kent Conrad, Joe Lieberman, Blanche Lincoln, Mary Landrieu, Evan Bayh, Mark Warner, Ben Nelson sent a letter to Senate Majority Leader Harry Reid asking him to strip the CLASS Act out of the pending health care reform legislation. They argued, quote, "We have grave concerns that the real effect of the provisions would be to create a new federal entitlement with large, long-term spending increases that far exceed revenues," end quote. And Kent Conrad, the Democratic chairman of the Senate Budget Committee, famously called the CLASS Act, quote, "a Ponzi scheme of the first order, the kind of thing that Bernie Madoff would have been proud of," end quote. More recently, on February 16, Secretary of Health and Human Services Kathleen Sebelius testified before the Senate Finance Committee and admitted in an exchange with Senator John Thune that the CLASS Act is totally unsustainable. Those are her words. It seems the concerns with the CLASS program are widespread, and I believe we can all agree that we do have a serious long-term care problem in this country as the costs are driving people into bankruptcy and weighing down the Medicaid program. We do need to address the issue, and the private sector, which already offers long-term care products, must be at the center. I now yield to my distinguished Vice Chairman, Dr. Burgess, for the remainder of the time.
I thank the Chairman for yielding. I too have concerns with the CLASS Act. I feel it's not sustainable as presently drawn, and perhaps my biggest concern is that it gives people the wrong impression of what they now have under the Patient Protection Affordable Care Act. We heard multiple people testify back in 2005 when we last looked into this that there was a concern that people were anesthetized as to their requirements for having some type of long-term care insurance, and I fear that this CLASS Act does again give people the false impression that now the government's going to pick up this expense, and in fact that nothing could be further from the truth. And then of course from the standpoint of employers, yet again another congressional mandate placed upon them. The CLASS Act is not an answer in search of a problem. We all know the problem exists. Unfortunately, this committee last really debated long-term care and long-term care issues in 2005. We never really got a chance to cover it during the debates on the Patient Protection Affordable Care Act. It's just a fact of life. Some of us are going to get older. As we get older, the likelihood that we will need some type of long-term care assistance grows. And I got to tell you, I've got a long-term care insurance policy. I bought it just after I turned 50, long before I ever ran for Congress, and I didn't buy it because I read an article in Health Affairs. I didn't buy it because I saw something on C-SPAN that impressed me that I ought to have it. I bought it because My mother told me if I didn't want to be a burden on my children, I would attend to that while I could. So for some people, unexpectedly early in life, an injury happens, and well over 4 million people under age 65 are in need of such care. 9 million Americans over 65 need some type of long-term care. The care can be costly, and the segment that the government picks up through Medicaid is an impressive number. A figure that was produced back in 2005 when we had hearings on this, that if we could move a third of projected seniors off of Medicaid into long-term care insurance in the latter 5 years of the 10-year budget window, which would be now, the federal government would save in excess of $150 billion, something that, in fact, could be quite useful today. The problem is hard. The answer is elusive. Market knowledge is important, but it can be confusing for the consumer. But I believe with the Class Act, we've taken a step in the wrong direction because we've given people the impression that they now have something which, in fact, they may not have. I thank the Chairman for the consideration. I'll yield back the balance of my time.
Chair, thanks, gentlemen, and yields 5 minutes to the ranking member, Mr. Pallone, for opening statement.
Thank you, Mr. Chairman. You know, Mr. Chairman, I have a great deal of respect for you and also for Dr. Burgess, but I have to start out by, dispelling some of the things that both of you said. I mean, first of all, I have to say I'm getting very frustrated because it seems like almost every hearing is an effort to repeal or debunk or defund something that's in the Affordable Care Act and suggest that somehow, it's not real. And this is just another example of it. I mean, the Class Act is very real. It is providing community-based services, cash, so that people can actually get community-based services. It's real. It's not something that is a fiction that we're kidding people about. They will be paying into a trust fund. They will get the money back when they become disabled and need it to go out and use that cash to buy community-based services so they can stay in the community. I don't. The other thing that really bothers me is that I don't hear any alternatives coming from the other side. I mean, Dr. Burgess correctly said that there's a real need for long-term care and support services, and this, he says, is no good. Well, what's the alternative? I don't hear it. We made a concerted effort, myself, Mr. Dingell, and the late Senator Kennedy, who was the Senate sponsor of this bill, to come up with a program that offers an alternative to provide services for disabled Americans so they can remain in their homes and in their communities. It was not put in as an effort to try to save money for the health care reform. We've been advocates for this for many years. You're talking about 3 people. I'm the youngest of the 3. I've only been here 23 years. Mr. Dingell and the late Senator Kennedy were here for a lot more years advocating for this legislation. It just happened to be that there was an opportunity to move this in the context of the Affordable Care Act, and we did it because we know that there are 10 million Americans in need of long-term services, and that number is expected to increase to 26 million by 2050. Meanwhile, more than 200 million adult Americans lack any insurance protection against the cost of long-term services. As a result, nearly half of all funding for these services is now provided through Medicaid, which is a growing burden on states and requires individuals to become and remain poor to receive the help they need, which is a terrible way to operate. So as Americans continue to age, we're faced with an impending crisis in long-term care. The implementation of CLASS offers a new approach that builds upon our existing safety net system and helps our elderly and disabled finance the long-term care they need to remain active and productive members of their communities for as long as possible. Now, I know this doesn't address nursing home care. I'm fully aware of that. But the need for community-based care is just as important as a method of financing long-term care in the nursing home. The nursing homes are paid for by Medicaid, but a lot of these services that people would be able to access through the Class Act are not even provided by Medicaid. That's why it's necessary. It's a voluntary self-finance program designed to assist Americans who choose to participate to proactively prepare for their future. People are taking on responsibility, basically saying, I want to prepare myself. I'm willing to take the responsibility. It focuses on personal responsibility, ensures as many choices as possible are available to those needing future services. I know my Republican colleagues have concerns about the program's sustainability and its impact on the budget deficit, But to them, I would say that the Secretary has the tools she needs in the bill to make sure this program does not grow into a new entitlement. The Chairman said it's an entitlement. It is not. In fact, the law requires that she certify the program to be actuarially sound and deficit neutral. If anything, this program helps alleviate deficit problems. As the CBO noted in its analysis, CLASS could save Medicaid $2.5 billion in the first 10 years, possibly additional savings after that. And conversely, the CBO estimates that repeal of CLASS would add $86 billion to the federal deficit. I continue to remind my Republican colleagues, if you start repealing the provisions of the Affordability Act, CLASS or some of the others, you're going to increase the deficit. And I strongly believe CLASS is an important step in the evolution of public policy because it's a framework based on the principles of independence, choice, and empowerment. CLASS is about ensuring you have the services and support you need to remain independent members of society, which is what all of us want. Now, I want to, I was going to yield to Mr. Dingell, but I think he's going to come later. So let me ask unanimous consent, Mr. Chairman, to enter into the record a narrative essay by Michael Ogg from New Jersey titled Running Out of Time, Money, and Independence, which I think powerfully illustrates the realities of the current long-term care environment.
Without objection, so ordered.
Thank you.
The gentleman's time has expired. The chair recognizes the chair emeritus of the committee, Mr. Barton, for 5 minutes.
Thank you. Thank you, Mr. Chairman. I'm going to yield some of that time to Dr. Gingrey. Last April, a month after PPACA was signed into law, the Centers for Medicare and Medicare Services Chief Actuary Richard Foster released a report entitled Estimated Financial Effects of the Patient Protection and Affordable Care Act. He estimated that by 2025, 15 years after PPAC was signed into law, projected benefits of this program would exceed revenues. CBO has estimated that benefits paid out will exceed premium payments by 2030, and Health and Human Services Secretary Kathleen Sebelius deemed the program as being totally unsustainable. Let me repeat that, totally unsustainable. Regardless of when this program is expected to become insolvent, we need to examine the CLASS Act to ensure that we're not creating another federal entitlement program which will simply be a burden on our federal budget. Last Congress, as the ranking member of this committee, I asked then Chairman Waxman to bring Mr. Foster in to testify regarding this report and the sustainability of the program. Chairman Waxman was not able to do that, so I'm very glad that Chairman Upton and Chairman Pitts have agreed to do it in this Congress. With the state of our economy being what it is right now and the massive debt that we're incurring, I think it's imperative that we rein in spending in order to protect our country's financial stability. Long-term care is a serious issue, and I believe that myself and all Republicans are very willing to support some sort of a program for long-term care, but it must be one which is sustainable and which is fiscally responsible. The program that we have in current law is not sustainable and is not fiscally responsible. Therefore, we need to review it and hopefully reform it. With that, I would like to yield 3 minutes to Dr. Gingrey of Georgia.
Mr. Chairman, and gentleman from Texas, I thank you for yielding. Mr. Chairman, if we could stop the clock just for a second to let me ask you a question. Were we each going to get 2 minutes for an opening statement or not?
No, we were
okay.
Just
right. Thank you, Mr. Chairman. And I thank the gentleman from Texas. The CLASS Act attempts to address an important public policy concern, the need for non-institutional long-term care, but that's not why we're here today. We are here today because the CLASS Act, according to the CBO, the President's own debt commission, and even the administration, is financially unsustainable and a potential time bomb for the federal budget and our economy. To quote the President's debt commission, sustaining the program over time will require increasing premiums and reducing benefits to the point the program is not able to accomplish its stated function of caring for the sick and disabled. Absent reform, the debt commission concluded, the program is likely to require large general revenue transfers or collapse under its own weight, end quote. To sum it up, the CLASS Act is a new entitlement nightmare created by or included in, as a gentleman from New Jersey said, Obamacare, that when it fails, it could harm disabled patients that would depend on it as well as Medicare seniors who are currently facing an unsustainable Medicare program of their own. So Senator Conrad, current chairman of the Senate Budget Committee, called the Class Act, and I quote him, a Ponzi scheme for the workers who are encouraged to sign up. The perpetration of a Ponzi scheme requires an ever-increasing flow of money from investors, American workers in this case, to keep this thing going, and it's ultimately destined to collapse. So my question is Senator Conrad right? This country does not need another Bernie Madoff fraudulent investment scheme, especially one run by the Secretary of the Health and Human Services. And I want to close with the Debt Commission recommendation for class. The Commission advised the Class Act be reformed in a way that makes it credibly sustainable. And if that's not possible, we advise it to be repealed. Mr. Chairman, I have not seen anything that would lead me to think this program can be made credibly sustainable. And if I'm not convinced otherwise after today's hearing, and certainly we'll listen carefully to the witnesses, I'll be dropping a bipartisan bill today with my good friend Dr. Charles Bustani, gentleman from Louisiana, to repeal this program once and for all. And I yield back.
With that,
Sure. Thanks, gentlemen.
Yield to Mr. Shimkus the remaining time.
Thank you, Mr. Chairman, Mr. Ranking Member. The national government's headed off a cliff. Our budget consists of Medicare, Medicaid, Social Security, interest on the debt, and the discretionary budget. All are following the actions of the Congress today, just trying to get to an end of a budget fiscal year. How in the world do we add another entitlement to the mix? How do we take 5 years of revenue making promises that we can't fulfill? This is a crazy process, and I'm glad we're having the hearing, and I yield back.
Chair, thanks, gentlemen. The gentleman's time has expired. The Chair recognizes the ranking member, Mr. Waxman, for 5 minutes.
Mr. Chairman, today's hearing is about much more than the nuts and bolts of the class program. At its core, this meeting is about an issue that has touched virtually every person in this room, public and private alike: the indignity, the burden, and the expense of long-term care services and supports, and our lack of decent, reasonable, and accessible program for those in need of this kind of assistance. The problem has been with us for a long time, and it is growing. With the aging of the baby boomers, the numbers are indeed quite staggering, and I'm sure we'll hear much more about that point from today's witnesses. But rather than facing the challenge, we have pushed the problem aside year after year, pledging to those in need that with just a bit more time, we could get a good program in place. And if the Republicans decide they want to repeal this program, I'd like to know what they're going to put in its place. We still haven't heard what they want to put in place for the health care reform that they want to repeal and replace. We know they want to repeal. What do they have to offer? Almost a year ago, we tried to keep the promise in creating the Class Act, a voluntary, self-sustaining, privately financed, and beneficiary-driven effort. We set in motion a process that will allow the elderly and the disabled to be able to stay in their homes, in their communities, and when they're no longer able to do so, as long as they're able to do so independently. And shame on those who would take this promise away and put nothing in its place. Having said that, all of us who support the class program, members of Congress, HHS, advocacy organizations, all readily agree that much work needs to be done before the program is ready to go live in 2012. That is what the 2 years of preparation time and the secretarial discretion and flexibility provided for in the enactment of this legislation. So let us get on with that task. Let us learn today about where the program is, where the program is going, how it plans to get there. And let us be assured that the requirements of the law will, in fact, be met. But along the way, let us not forget who and what brought us to this point. The Tony Youngs of America. Tony, we're going to hear from later, is one of our witnesses. Their families, and the discouraging and often devastating experience of simply wanting to stay put and remain engaged and productive, and being told that's not possible. The class program is designed to change all that. Let's give the Class Act a chance and keep our promise to those who have waited so long for meaningful reform. And I want to yield the balance of my time to Mr. Dingell.
Mr. Chairman, I thank my good friend, Mr. Waxman, for yielding me this time, and I commend you for having this hearing. Oversight is an extremely important undertaking, and this will enable us to come to conclusions as to what is the best thing for us to do with regard to the Class Act and how it can best be made to enable us to serve a terrifying unmet need for all of our people. This is a proposal that was put into law, as you will remember, by the ranking member of the Health Subcommittee, Mr. Pallone, and by my dear friend, Mr. Kennedy, and Senator Kennedy and I. And it's a vital program in the part of the health reform law. It will fill an enormous unmet need in our society: affordable long-term care services and support for 10 million Americans in need of long-term care now, and some projected 15 million Americans that are going to need that by 2020. Currently, Americans in need of long-term care, whether they're functionally disabled or elderly, find themselves with few options, if any. Private long-term care insurance is available, but options are limited and costs are too burdensome for many families. This legislation, the CARE Act, the Class Act, is not an entitlement program. It is a voluntary program. And in our review today, if we will work together, we can come up with an intelligent way of making it work and be acceptable in terms of the budget constraints and concerns that we have. And I call on my friends to approach it that way rather than to seek to repeal a program which has so much opportunity to help and benefit our people who have desperate needs and their families who suffer. The Medicaid cannot continue to be the only affordable long-term care service available to Americans. And I would call on my colleagues to know that the Class Act enables people to pay a part of their costs through premiums which they pay prior to the time that they have need of the program. That is an extremely important difference between it and Medicaid. And my urging to my colleagues on both sides of the aisle, particularly the majority, is let's work together to make this a good thing, to make it work for all the people, and to stop some of this nonsense about fighting about legislation of this kind, when in fact we could work together to make things better for Americans in a fiscally responsible and proper way. I thank you for holding these hearings, and I thank my colleague for yielding me this time.
Chair, thanks, gentlemen. Gentlemen's time's expired.
Mr. Chairman, may I ask unanimous consent that the statement from the Jewish Federations of North America be inserted in the record?
Without objection, so ordered.
Mr. Chairman, may I make a similar unanimous consent request? The AARP has an excellent statement which they have presented to me to ask me to have it submitted to the committee by unanimous consent. And I ask unanimous consent that that excellent statement be inserted in the record.
Without objection?
Mr. Chairman, may I ask unanimous consent that our side could be allowed to see those letters?
All right, if you can pass those down, we'll take a look at them. All right, we have two panels today, and I'd like to introduce the first panel at this time. Assistant Secretary Kathy Greenlee was appointed by President Obama and later confirmed by the Senate in June 2009 to serve as the Assistant Secretary for the Administration on Aging, an agency within the U.S. Department of Health and Human Services. In January of this year, Assistant Secretary Greenlee was designated as the Administrator of the Community Living Assistance Supports and Services, more commonly referred to as the CLASS program. Prior to joining the administration, she served as the Secretary on Aging in Kansas and as the General Counsel of the Kansas Insurance Department. In addition, Ms. Greenlee served as Chief of Staff and Chief of Operations for then Governor Kathleen Sebelius. Your written testimony will be entered into the record. We ask that you summarize your statement in 5 minutes and then be available for questioning. We look forward to your testimony. The witness is now recognized for 5 minutes.
Thank you, Mr. Chairman. Chairman Pitts, Ranking Member Pallone. Is this working? I can tell it is. Thank you, Mr. Chairman. Chairman Pitts, Ranking Member Pallone, and members of the subcommittee, thank you for the opportunity to discuss the implementation of the Community Living Assistance Services and Supports Act, or what we all commonly call the Class Act. Today, approximately 10 million Americans need long-term services and supports, ranging from having an aide visit for a few hours a week to living in a nursing home around the clock. As America ages, that number is rising steadily. By 2020, it's expected that 15 million Americans will need some kind of long-term care. We know that 1 out of 6 Americans who surpass the age of 65 will spend more than $100,000 on long-term care, and far more will need less extensive but substantial care. More than 1 out of 5 persons who enter a nursing home will spend down their own resources and qualify for Medicaid after virtually exhausting their savings. Unfortunately, only 8 to 10% of Americans have private long-term care insurance, and new enrollment is declining while major long-term care competitors have exited the market. Taken together, this means that many Americans are not well prepared to finance long-term care services and supports that they will need. There are a number of reasons for this reluctance to prepare. First, 4 out of 5 Americans mistakenly believe that Medicare will provide them with extensive coverage for long-term care, and it does not. In addition, while Medicaid is the primary payer for long-term care, paying approximately 50% of all nursing home expenditures in this country, Medicaid requires that individuals impoverish themselves in order to qualify for long-term services and supports, with only modest protections for the needs of a spouse who remains in the community. Americans also frequently misjudge the likelihood that they or a spouse will someday need long-term services and supports. And many people are unaware of the costs of these kinds of supports. A year of nursing home care costs around $75,000. But it isn't just individual budgets that are stretched. Recent data from the CMS Office of the Actuary show that in 2009, Medicaid spent $111.2 billion on long-term care, and spending on those services is projected to increase as the population ages, stressing both federal and state budgets. Prior to coming to Washington, as the chairman acknowledged, I had the honor of serving as the Secretary of Aging in Kansas. The Secretary of Aging in Kansas has a unique portfolio. I oversaw community aging programs as well as the Medicaid-funded programs for both nursing home services and home and community-based services for frail elders. I also had the opportunity during my service in Kansas to spend 8 years as an insurance regulator, serving half of that time as the general counsel for the Kansas Insurance Department. I have visited dozens of nursing homes and spoken to thousands of seniors. I have managed a Medicaid budget. And what I know with certainty is that all people, regardless of age, hope to maintain their independence for as long as possible. I know and respect many nursing home providers. Their particular task is difficult. But for all of us, we hope to postpone nursing home admission for as long as possible. And some people swear that they will never go to a nursing home. Fortunately for policymakers, people prefer to live in the setting that is the least, not the most expensive. In most cases, that setting is home. How then do we help people prepare for the costs associated with aging and disability and increase their access to home and community-based services and community supports that they so desperately need? The CLASS program offers one new tool to support Americans' long-term care needs and help them remain independent. Its goals are to provide an opportunity for individuals to take responsibility and to prepare financially for their own long-term care needs, support consumer choice related to their own care and their living arrangements, and facilitate independence and community living. President Obama and Secretary Sebelius have pledged to use the discretion provided in the law to protect the solvency of this program. There are changes that we intend to make through the Secretary's regulatory authority to guarantee the solvency. We are committed, as the Secretary said in a recent speech, that we will do everything we can to make these changes to ensure the solvency. As the Secretary has outlined, and I can spend more time discussing with you, there are a number of things that we have in mind that we will change by regulation. We need to change the employment and earning requirements for the program. We need to close loopholes that allow people to skip payments and then enroll at a later time. We need to explore options for indexing the premiums along with the benefits. We need to tailor the benefits to more closely meet the individual needs and preferences. We need to educate the public about long-term care. And we need to partner with employers and also protect fraud and abuse. We will do all of this in full view of the public with a transparent process. We will do everything we can as we move forward to implement this law responsibly and protect its solvency. Thank you.
Chair, thanks, the gentlelady. We'll now begin our our questioning, and the chair recognizes himself for 5 minutes for questions. Madam Secretary, some have suggested that in order to have a sustainable program, the monthly premium may have to be at least $240 a month or higher. When will your agency announce what the monthly premium will be, and is it possible the premium could be as high as $240 a month?
Mr. Chairman, you have two pieces of that I would like to address. In terms of the plans for announcing the monthly premium, the proposal going forward is that we will submit 3 plans as recommended in the law to the Independent Advisory Council for their submission to the Secretary. We will then publish in a reg, most likely this fall, our initial assessment of those 3 plans. I do not know at this point whether or not that initial publication will include specific pricing information, but it will provide information about the specific plans that we're looking at. We know that the best way to protect the solvency of the program is to ensure high participation, and participation will be a function of several things, including the price of the product.
Thank you. On the Administration on Aging's authority to increase premiums, do you believe the Secretary has the authority to increase class program premiums? And if so, on what basis, and are there limitations?
Mr. Chairman, it's clear in looking at the law that the Secretary was given many protections once the program is enacted in order to adjust or make changes to the premiums. The list of recommendations that I have suggested are things that we need to do early through a regulatory process, not just to adjust premiums, but to deal with the indexing of the premiums to help protect the financial solvency. So she has the authority both after the program is adopted and now.
The President's fiscal year 2012 budget request includes $120 million to begin the implementation of the class program. However, just last month, Secretary Sebelius admitted the class program to be, quote, totally unsustainable, end quote. Madam Secretary, do you agree with Secretary Sebelius that the program in its current form is unsustainable? Yes or no?
Mr. Chairman, if I could elaborate beyond a yes or no, I could be more responsive. The Secretary is referring to the conclusion we've come to by a plain reading of the specific statute without adjustment. We are committing to making reforms to the program so that we can hit the financial targets that she is required to meet to make sure that the program is solvent.
Can you please explain why the administration requested $120 million for FY 2012, of which nearly $94 million was for outreach and enrollment efforts, when the administration's chief health official clearly does not believe the program is sustainable in its current form?
Mr. Chairman, the Secretary's comment with regard to not sustainable in its current form is her explanation as to why we will reform the program. We don't intend to implement the program without those changes. The request for the $120 million is startup funds so that we can begin the program. This is a new program. It's a type of product that has never been offered to the American public. As I said earlier, participation is key, and we will need to do an education and outreach effort to America to describe not just the program, but the need that they have that's currently unaddressed.
And can you please provide more information on the changes you believe you will need to make to the program in order to make it more sustainable, including premium increases and your intended timeline for doing so?
Certainly.
And Chair yields to the Vice Chairman, Dr. Burgess.
Yes, Secretary, thank you for being here. Do you have do we have an idea? Secretary Sebelius testifies to the fact that the program, as drawn, may be unsustainable. Do you have an idea as to when that realization occurred, when that information became available to the Secretary?
During the past year, after the law was passed, we have worked to develop 2 actuarial models that include the best of actuarial science as well as economics. Each of those models has led us to the conclusion that to protect the solvencies, there are some changes that we need to make to the program.
And will those changes likely be on raising the premium, reducing the benefit, combination of both, or draw the federal treasury?
Congressman, the changes I've mentioned briefly, they're more just fully described in my written testimony, but they are changes that can be made with regard to earnings, anti-gaming, fraud protections, and indexing the premiums, which will help strengthen the program.
I'll get to that in just a moment, but we do need to pursue that a little bit. Thank you.
Chair, thanks, gentlemen. My time has expired. Chair recognizes the ranking member, Mr. Flown, for 5 minutes for questioning.
Thank you, Mr. Chairman. And I want to ask questions, but I have to say, and again, not meant with any disrespect to you or the Republicans on the other side, but it just seems that we know we have a huge problem out here with people not having these community-based services, and the Democrats come up with a plan to try to address it, and it just seems like everybody on the other side is like so scared, like there's this fear of a new program, and we're going to get the word out about it. And I mean, the bottom line is when you have a problem, you try to address it. And yes, it's going to be new, and there are going to be some problems in implementation and outreach. But that's what happens when you try to do something new, address something that hasn't been addressed before. And I appreciate the Assistant Secretary for pointing that out, that, we're trying to do something that's never been done before. And so naturally there are going to be some kinks in it. But that's what happens when you try to address something that hasn't been addressed. Now, I just wanted to ask some brief questions, if I could. First, I wanted to start with this decision that we made to put the program in your agency, Administration on Aging. Some suggest that, that's not the proper place for it. Why is the program being housed there, and how prepared do you feel you are, and did we make the right choice? Quickly, because I want to get to another one.
Congressman, the Secretary has the authority to reorganize Department of Health and Human Services, which gives her the authority to place it at the Administration on Aging. This is a different kind of program than AOA has run in the past. But the connection is that we have long expertise in providing services in the community that help support independence. And I believe that I also have the credentials to help make this possible.
Now, we heard, thank you, we heard, statements here. The Republicans referenced the Secretary's statements about loopholes and sustainability and the need to strengthen the program. But I see the basis for the Secretary, exercising flexibility and discretion given to her in the law to implement it and make program improvements that address these loopholes and sustainability. Would you tell us where the administration is in reviewing some of these criticisms, statements that were made by the chairman about loopholes, sustainability? How are these being addressed?
As I had mentioned earlier, we've spent the last year analyzing the law as written so that we have a fundamental science to the analysis. We have hired an actuary for the class staff who will now build on that, develop solvent programs that we can take moving forward. But we know there are changes that we need to make to protect the solvency. The Secretary not only has the authority, she has the responsibility to roll out a solvent program, and we take that very seriously.
Okay. And then the last thing I wanted to ask is the process by which the requirements, the guidelines, the nuts and bolts of the program, if you will be disclosed and subject to review by the relevant stakeholders. And how will the department go about publicizing the framework of the program and at the same time seeking advice of those with an interest in its operations?
There are two primary ways. We will work with the Class Independence Advisory Council, which is clearly set forth in the law to be a place where we go for additional public input, stakeholder input, and we will go through the federal rulemaking process so that we will publish regs and have full opportunity for the general public to comment. We will review those comments and address them as we move forward.
Well, I appreciate that. I just wanted to point out a couple other things, and again, I'm trying to sort of address some of the criticisms that were made by my colleagues on the other side. Statements were made about how this is a mandate to employers. That's not true. Employers, decide whether they want to have their employees participate in this. It's voluntary. Now, obviously, as you've said, Madam Secretary, we want as many employers as possible to participate because the price, if you will be lower if the more people participate, and it's very important. But it is not mandated. The law specifically says that, employers can decide whether to sign up, and obviously you're going to try to get as many of them as you possibly can. But if you'd comment on that.
That is correct. Both employers and employees will have a choice about whether or not to participate. We will work actively with the employer community to make it as easy as possible for them to participate or to help individuals participate because we need a large number and a broad risk pool of people to apply. I
appreciate that. And, I'm just going to, I got about 10 minutes left here. Again, I just want to stress. Oh, I don't?
10 seconds.
Oh, 10 seconds. Well, I just wanted to sorry, now I have nothing left. No, I just want to say again, we're trying to address something that hasn't been addressed. You said that. We're going to have some kinks, but let's move forward. Let's not repeal it. I really feel strongly that way. Thank you.
Thank you.
The gentleman's time has expired. The Chair recognizes the Vice Chairman, Dr. Burgess, for 5 minutes for questioning.
Again, thank you, Secretary Greenlee, for being here. And your testimony is important and certainly underscores some of the testimony we had when we last had hearings on this in 2005, and that is the general lack of knowledge of the general public about the importance of having long-term care insurance, your reasons why people don't pursue it, not wanting to think about unpleasant things in the future, thinking that some other federal agency is going to pick this up at some point. So all of this is extremely important. I guess the question just comes up. You have mentioned the $120 million budget that is spent this first year on developing the program. What do you think we could have done with $120 million is just sort of increasing awareness, increasing the general public's awareness of this as a problem and what options are out there for them? Could we have done a better job?
Absent, I want to make sure you understand, without a program attached to it, just a general.
There are programs available. I bought one in the year 2000. Again, it wasn't because I read an article in Health Affairs. It wasn't because I saw somebody on C-SPAN who looked smart. My mother told me that, hey, if you don't want to be a burden on your children, like I am on you, then perhaps you'll consider long-term care insurance. And indeed, I investigated it and made a decision to purchase it. Now, it wasn't a particularly, it was one of those things that one of those bets I hope that I'll never get covered. But at the same time, if more people are aware of the importance of having this, what the implications are of not having this, do you think we could have perhaps done some good with $120 million as a public outreach program, even employing old Andy Griffith to tell us about it?
The private long-term care insurance market has been selling for 30 years and have only reached a penetration of probably 10% in the market. Clearly, there's a need for more people.
If I could, we make it extremely hard. There's no tax deductibility for long-term care insurance like there is for some of the employer-sponsored insurance. You can't pay the premium out of a medical savings account or a health savings account. These are all after-tax dollars that have to be invested. There are things we could do on the policy side, absent a class act, that would have made a difference in the number of participants. I'm not saying it would have solved the entire problem. Surely there are still going to be people who are going to need a medical safety net. Medicaid is not obviously going to go away, but it always seems like the default position is we're going to expand those federal programs. You talk about fraud and abuse and wanting to be able to clamp down on that. I salute you for that. I want you to do that. But at the same time, when you look at those third-party payment programs that are subject to fraud and abuse, it's never United Healthcare that you read about in the front page of the newspaper that has a problem with too many wheelchairs going out. It's Medicaid. It's Medicare. It is those public programs that seem to be so vulnerable, where the dollars seem to be so vulnerable. Why not try to partner with those people who are already out there offering private long-term care insurance and try to build on that, perhaps remove some of the obstacles, work with policymakers to remove some of those obstacles to purchase of long-term care insurance?
Congressman, the product that the Class Act represents is a different market than what the long-term care insurance market has ever addressed. This is for a different group of individuals with a limited benefit. The private market has always offered comprehensive long-term care insurance, which many people need. And I agree that there are new opportunities, new ways to reach that market.
Well,
but that is not the same market that the class program is.
Well, let me ask you this. Do you think when people look at, and granted people's understanding of things sometimes is is more superficial than I think it should be. But as people look at the Patient Protection Affordable Care Act, say, aha, they've got the Class Act in there, are they going to be more or less inclined to more seriously look into private long-term care insurance should they be able to afford it? Or is there going to be an acknowledgement in people's mind now that, yeah, the government's taking care of that for me, I don't have to worry about it?
This is a supplemental program, not comprehensive need. So the answer for an individual would depend on what they could afford to purchase for themselves.
But
whether
do you
or
think
not
there is
they
a
felt
general
like they could
awareness that this is a supplemental program? It's not the way I hear it talked about in the media.
That's part of the reason for the budget request, so that we can be very clear with the public so they know that this is for a supplemental supportive program and not a comprehensive product.
Look, when I grant you that H.R. 3200 never saw the light of day after it left the House floor, but when we marked up the health care bill in this committee, the Class Act was brought in at the last minute as kind of a shell bill. It was to be filled out by other committees, and in fact, it was put together as a hodgepodge on the Senate floor on Christmas Eve. That's why we've got the problems that we have, and we ought to be honest about addressing that. Fix what we can, but understand that this was not an ideal program, was never properly vetted by the United States Congress. I'll yield back, Mr. Chairman.
Gentleman's time has expired. The chair recognizes the ranking member of the full committee, Mr. Waxman, for 5 minutes for questions.
The gentleman was correct about private long-term care insurance. It's what we hope people would buy to take care of themselves. Otherwise, we end up with people on Medicaid. And in nursing homes right now, which is the most expensive place for long-term care, 70% is paid for by Medicaid. And I don't think that means 30% is paid by long-term care insurance. It means a much smaller percentage of the 30, because a lot of people are there still under Medicare or they're paying it out of their own pockets. So long-term care insurance has not been a great success so far. The federal government allows employees to buy long-term care insurance, and it's negotiated by the Office of OPM, Office of something management, whatever it is, program management,
Personnel management.
personnel management. Okay. Do you have an estimate of how many federal employees have taken up long-term care insurance?
Mr. Waxman, I can get that. I don't have that.
Okay, well, I'd like to have that for the
here,
record.
But it's a small percentage, around 5%. But I would need to verify.
I think when we look at the fact that very few people put away money for their retirement, which is pretty astounding, to get them to buy long-term care insurance that they may never use and are in state of denial. If they're in state of denial about retirement, they're even in a greater state of denial about long-term care needs. So I don't see that long-term care insurance is the way we're going to solve the problems. This, you answered the question I had. This is not a replacement for private insurance. It dovetails quite nicely with that market because it's a supplement to long-term care insurance. Isn't that accurate?
Actually, I would say it as the reverse, that it's the first step for an individual to protect themselves from costs. And if they want to protect themselves further, the private market would be there to help them.
Yeah. Medicaid has been the primary safety net provider for poor and elderly and disabled people. And elderly and disabled become poor once they start paying for the high cost of long-term care. It pays 40% of the cost of long-term care services. It's the largest payer, therefore, of these services in the nation. There are 1 million nursing home residents under Medicaid. That's 70% of all nursing home residents. In addition, there are 2.8 million individuals receiving community-based care services through Medicaid. So Medicaid is the biggest payer for long-term care services. And it comes at a high price. Each year we expect to add $44 billion to the price tag of Medicaid due entirely to an increasing demand for long-term services among an aging population. These are vital services, but they take an enormous toll on state and federal budgets, especially during the times of economic downturns as we're now experiencing. In the 2009 CBO analysis of the Class Act, there are some Medicaid savings because, at least in the last 2 years of the 10-year window, that come to $2.5 billion in those 2 years. Do you believe this program has the potential to save even more Medicaid dollars?
Yes, sir. There are two primary ways that we'll see Medicaid savings. People who receive both Class and Medicaid depending on whether they're in the community or in the nursing home. We'll pay a portion of that back to the state for Medicaid. But even more importantly for savings, the CLASS program can help people prevent spend down to Medicaid, use their own resources with the CLASS program resources to stay in the community without asking for Medicaid.
Well, I'd say to my Republican and Democratic colleagues, if we look down the road of how to deal with this problem without humiliating people to have to go through the indignity of becoming a Medicaid recipient after they've exhausted all their money, we can go one of two ways. We can require people to buy private insurance for long-term care. We can require them to pay the money and buy it, and then they'll be covered. But I hear a lot from my Republican colleagues that they don't like a mandate, and that would certainly not be a real popular idea, I would expect. The other is to say everybody should pay into a fund. You know, if everybody, this is a real clear insurable event. If everybody paid into a fund, it would be a small amount to pay for a relatively limited use of these funds for those who are going to need long-term care. Unlike Medicare, which serves everybody who becomes eligible for it because they need health care services, long-term care is like a catastrophic kind of coverage for people who need these services. And that might be a real good social insurance system. I just hope my Republican colleagues don't look down their nose at all idea of social insurance, because I don't know what other choices we have, because Medicaid is not sustainable with this burden. So I thank you for what you're doing, and let's hope that this little program, and it's no answer as far as I'm concerned to the big issue, can help.
Gentleman's time's expired. Chair recognizes the gentleman from Illinois, Mr. Shimkus, for 5 minutes.
Thank you, Mr. Chairman. And I appreciate Chairman Waxman's calm approach. I mean, we all know this is a major issue, and I'm a original Mikasa guy when we had federal dollars following the individual and independent, helping people remain independent as long as they can, and have them make the decisions based upon dollars versus government making that decision. So, you know, don't take these questions as being harsh or accusative. We've got a couple issues here. You're going to hire an actuary. You're promising it's going to maintain solvency. An actuary, if it goes out of solvency, the actuary is going to have to decide one or two things: raise revenue or cut benefits. Is the Secretary willing to do that?
Mr. Shimkus, we have already hired an actuary.
No, I know.
Right.
I made that statement.
Right.
That was my statement.
And before we move forward, as the law requires, we will work with the CMS actuary as put forward. The Secretary is only willing to move forward to implement the law if we can demonstrate that it's solvent to the standards of the law from the very beginning.
So we're having 5 years of revenue, no payouts. Initially, that's going to be an easy decision. Our concern is year 10, year 15. And then I follow up with the question again. If then there's a solvency issue, will she be willing to raise premiums or cut benefits?
The law requires the CMS actuary, by way of this other work that we've done, to certify for both 25 and 75 years that the program is solvent. And we are committed to that before we start the program. Thereafter, both the Secretary and the Board of Trustees have the ongoing fiscal oversight of the program and the authority to make the changes that they might need. But we won't start the program unless we think it's solvent from those modelings before we begin.
Well, I hope, Mr. Chairman, we were able to have the administration back numerous times to help you all review your actuary and your numbers to make sure it is solvent. Because in my opening statement, I mean, we do concern about making promises that we can't deliver. We've done it in our entitlement programs, and they are bankrupting us. And so that's the concern. So the actuary is going to calculate payments out based upon payments in and people in the pool. What about the annual expense? Your budget request, or the budget request, is $120 million for this program. Is that part of the actuary numbers?
The program is designed to be self-sustaining, to pay benefits only from premium dollars. So once the program is up and running, then that's how it will operate.
What about the overhead?
And that's contained within the premium revenue structure that I just described.
So we won't see another additional annual request for money to administer this program?
No, the current request is for startup funds.
Do you ever feel that the Secretary can go into the $17.5 billion health care slush fund, which is under Title Section 4002, Prevention and Public Health Fund, which is $17.5 billion. Might she tap into that? It's at her discretion.
I have never had a conversation where that even came up in discussion of the class.
Well, would you ask her for us?
Yeah, I can follow up with you.
Good. That would be great. Because that's our concern in the fiscal environment. We already got the Secretary to admit 2 weeks ago that she double counted $500 billion, which really addresses the fact that the statements about that the health care law pays down the deficit and the debt is untrue. It could be true if you double count $500 billion. It's untrue when you adequately put the $500 billion in its proper concerns. If we want to help our citizens, we have to have sustainable funds. Our belief is always government doesn't have a good record. We're hoping that you can prove us wrong in this, and we'll be following closely. Thank you, Mr. Chairman. I yield back.
Chair, thanks, gentlemen. We are voting on the floor. We've got 2 votes. Let's take one more 5-minute questioning from the ranking member emeritus, and then we'll recess until immediately after the second vote. Chair recognizes gentleman, Mr. Dengel, for 5 minutes.
Thank you for this hearing, which is a very useful thing. I begin by welcoming the Secretary, and I ask, do you have all of the authority you need at the Department to assure that this program gets off to a start in an actuarially sound manner?
Yes, we do.
And you lack nothing?
No, we can make it solvent.
Very good.
Have the authority.
Now, I'm going to make a statement. You tell me yes or no. 10 million Americans are in need of long-term services now, and in 2020, 15 million Americans will be needing long-term health care services. Is that correct?
That's correct.
Now, Madam Secretary, it's my understanding there are a number of long-term insurers in the United States that are, and a number of them are leaving or planning to leave the market. Is that true?
Yes.
In my opinion, this seems to offer individuals in need of long-term insurance much more limited options. Do you agree?
Yes.
Isn't it true that the goals of the CLASS program is to help Americans prepare for the unexpected and to allow them to participate in a choice that offers them services and allows them to remain in the community rather than to go into the nursing home?
Yes.
So if I understand the program correctly, and I was one of the authors of it, it is going to allow an individual to buy into this program at an early time. Is that correct?
Yes.
And so that individual will pay money into the program before that individual begins to draw benefits.
That's correct.
That's conventional insurance practice, is it not?
Absolutely.
And you will see to it it's done actuarially soundly.
Yes, we will.
Now, that will absolve Medicaid of providing these same benefits in a nursing home, will it not?
Congressman, it will help buffer the cost of Medicaid, but it won't cover the full amount of a Medicaid.
It'll help the individual stay home.
It'll help the individual stay home.
Okay, and instead of the taxpayer paying 100% on Medicaid, the individual who derives benefits under the plan will be paying into the plan, so he'll be actually paying a significant part of the cost instead of that coming out of the pocket of the taxpayers by way of Medicaid. Is that correct?
He will be paying, or he or she will be paying, yes, a portion of the class benefits back to the Medicaid program.
Good. Now, as you said in your AARP says that it's going to save, in their rather excellent statement, it's going to save about $2 billion to Medicaid due to the Class Act. Is that correct?
Yes, that's consistent with the CBO score as well.
Is that an actuarially sound statement by ARP?
I haven't looked at their methodology, but I do know it was the CBO score as well.
Now, Madam Secretary, as you said in your testimony, Medicaid now pays for about 50% of the nation's nursing home expenditures, and in 2009 spent $112 billion on long-term care services. Isn't it probable that by offering the ability to individuals to remain in the community and out of the nursing home, that it will help to help Medicaid to reduce its costs, and also it will help reduce nursing home costs?
Congressman, it will help individuals use their own resources and the class resources to postpone the need for Medicaid.
Okay. So wouldn't I be fair in assuming that the Class Act will fill an unmet need in terms of providing long-term affordable health care services and to support people in need?
Yes.
Now, do you believe that the Class Act will help today's workers to prepare for and provide for their personal long-term needs in the future?
Yes.
Mr. Chairman, I note that I am returning to the committee 33 seconds.
Chair,
I
thanks,
yield back
gentlemen.
the balance of my time.
Chair, thanks, gentlemen. And on the unanimous consent request of the gentleman, Mr. Waxman, and Mr. Dengel, without objection, the documents are entered into the record. So ordered. We will now recess until immediately after the second vote. I trust the witnesses will bear with us. We'll get back as soon as possible. Thank you. The committee's in recess.
Okay, we're going to make a break for diving. What are we taking? That was cool. Oh my goodness, love it. I'm not going to. I was finding everything green this morning. We can go get the last minute. Where? They got here super thank you. Yeah, I looked at him and I go, hey, the
Although, you know, it does seem like Burgess has done a little bit of homework.
Yeah.
You know, what's interesting is, you know, they know enough to be dangerous.
Yeah, exactly.
I'd say, you know, Secretary Greenlee for president, she's doing much better with her messaging.
She's done a great job.
She's keeping it brief.
Yeah, she's really good. She can tell her lawyer training. She doesn't
Yeah.
wander off into totally unsustainable and unworkable program.
Once she asks the permission, we ought to ask her a question. That's a woman who knows how to listen.
Right.
You know what I mean? You didn't follow the
Simple,
path.
answer the question, and move on.
She's doing good.
She is.
So,
No surprises.
Yeah, nothing shocking.
no.
You can handle this.
Connie's already working.
Yeah, no, she's already.
Yeah, it's
Yeah, no, she was so right there. God is so right on this.
one thing that I told the prevention. And I should have thought that they're trying to link everything back to this hospitalist bid and prevention.
Probably that's right.
But it won't be today, that's for sure. Did you see anything on the CRS questions about the Secretary's discretion?
I thought that's kind of model. So actually gives me
Okay, ready? Yeah. The recess time having expired, we'll go back to questioning, and the Chair recognizes the gentleman from Louisiana, Dr. Cassidy, for 5 minutes for question.
Thank you, Mr. Chairman. I can't help but notice that Mr. Waxman pointed out the indignities of people being on Medicaid, and yet the PPACA put 16 million people on Medicaid by design and more by effect. And so I found that an interesting comment. And I'll also remark that the people on the other side of the aisle who are so frightened of weather forecasts 100 years from now are so sanguine about realistic predictions of bankruptcy within 11 years. Now, I am a physician who works in a public hospital, so I'm very familiar with people, politicians overpromising and underfunding. So, do I call you secretary or assistant secretary?
Either one is appropriate.
Great. Madam Secretary, I just want to take the logic from the other side of the aisle and go through this. Their argument about an individual mandate is that if you don't force people to be in the insurance program, only those who are sickest will take the policies, and it enters the so-called death spiral where only the sickest are in it, but those who would have to support them by not being sick but paying premiums get out because of expense. Now, you by law are mandated to keep this actuarially sound for 75 years. Let's assume the logic is correct, that we're going to enter into a situation where only those who are going to benefit wish to be in, and those who, frankly, don't see it in their financial interest to do so, choose not to join. Now, you have to, obviously, by law, make the premiums effective. So it seems to me, and tell me if you disagree, if there is this adverse selection, that progressively you will have to raise the premiums, so much so that you'll enter into the death spiral we heard so much about regarding the private health insurance market.
Congressman, as you've heard me testify, we are absolutely committed to the solvency of the program. And the key to the solvency will be broad participation.
Now, but keep in mind my presumption. My presumption is that they are right, that without a mandate, only those who benefit financially choose to participate. And you, if you will, drop out those who don't see it in their financial interest to pay a lot in and get a little out.
The underlying question is, what is the method by which you gain broad participation?
No,
so
my underlying question is this at risk of entering the death spiral?
We must have broad participation, and not only people who could access the benefit early in order for it to be financially
And
viable.
is it possible, just Mr. Waxman spoke about potentials, so is it potentially true that, again, we would have a lot of non-working spouses who would participate, which I gather would be thought to be at a higher risk for claiming benefits without paying in over the long hauls, someone actively working, et cetera, that people over 65 cannot have their premiums adjusted upward, all those things that obviously limit your ability to raise premiums on anybody but the younger working class, that as those younger people see, well, this premium's $240 a month for a benefit that I'm supposed to get when I'm 70 years old. I got to buy a car. Is there the potential for this adverse selection process to occur?
Congressman, you are describing an adverse selection death spiral that would occur if the program only attracted those individuals. We are familiar with the
potential? Is there a potential? Because I tell you, the second panel, when I read the testimony of the second panel, 4 out of 6 agreed that there is a strong potential for that death spiral to occur.
It comes back to the question of broad participation, and all of the actuaries we work with, all of the actuaries that will testify after me, also understand that a basic insurance sort of fundamental principle is broad participation.
So let me ask you, have
you
you put into your models, if you have premiums of $240 a month, how broad your participation will be?
We have looked at different pricing mechanisms, different pricing options, and looked at what a similar product looks like in the marketplace, and understand to get broad participation, we must be competitive, both in product design and in price. I might return to something that you said just to tell you that non-working spouses are not eligible in this program. I believe that was considered in an earlier bill that came through Congress, but that actually wasn't a feature that was.
So let me finish up by saying, again, I will see patients on Monday at a public hospital in which politicians overpromise and underfund, and I see that it's ultimately the patient who pays the penalty. So it's very easy for us to promise when future generations have to pay, but I'll tell you it won't just be future generations that pay, it'll be future so-called beneficiaries. Unless you can convince me there's not a death spiral, I have to admit I have to be more skeptical of this than of a 100-year forecast. So, thank you.
Chair, thanks, gentlemen. Gentleman's time's expired. Chair recognizes the gentlelady from California, Ms. Capps, for 5 minutes for questions.
Thank you, Mr. Chairman. One general comment, if I may, to begin. While I appreciate hearing from this administration on the topic of aging, and certainly on your testimony, Madam Secretary, but and about the importance of long, strong term care and program accessible to all Americans, I can't ignore the fact that this hearing is yet another in a long line organized by those on the other side of the aisle obsessed with repealing the Affordable Care Act. When repeal doesn't work, they try to defund. When defunding doesn't work, they try to find targets like school-based health centers or the class program to cut off. As the ranking member has said, it's like deja vu all over again. So I will continue myself to ask for a hearing on the number one issue to our constituents, which is jobs, and I will continue to ask for this subcommittee to come together and support our health care workforce. I also find it concerning that while the Republican members of this committee are declaring the program we are discussing today unsustainable, actually they should be taking credit for the flexibility that will be the key to ensuring its success. In fact, there is a Politico article today which describes how the class program flexibility came to be. It was an amendment by then Senator Judd Gregg, and it was accepted unanimously by the Senate Help Committee. In fact, after it was agreed to, Senator Gregg went on to say that his amendment ensures that the program will be fiscally solvent and that we won't be passing a buck to future generations. So, Honorable Secretary, Ms. Greenlee, considering the amount of flexibility in the program design that you've already discussed, do you agree with Senator Gregg in his assessment?
Congresswoman, as I understand, in response to Senator Gregg's concern, the 75-year requirement was placed into the law so that we look long-term. And we're required to look long-term from the very beginning to know that we can hit that marker before we ever start the program.
Thank you. Now, I acknowledge in this committee a strong difference of opinion among some of us on the substance of this program, but the overall issue should be one we can easily agree on. The current system for affordable long-term care is not just broken, it is all but non-existent. Long-term care insurance is far too expensive for most individuals, and Medicare does not cover the range of care needed. Instead, we asked Americans to spend down their savings, sell their assets, and purposefully become impoverished so that they can access the Medicaid program, the primary long-term care provider in most of our country. 2 weeks ago, this committee heard how expensive Medicaid is, both to the federal government and to the states. This is particularly true in regards to long-term care, but right now, what other option is there for most Americans? My colleague, Mr. Waxman, accurately described how Medicaid costs could be lessened by this program. Before many families get to this point, they often struggle to find needed care for their loved ones themselves. I think it's fairly clear and straightforward how the CLASS program would benefit people who might need assistance with such activities of daily living as dressing, toileting, eating, sometime in the future. This could be the case for all of us. But the program also promises to help those individuals who provide this kind of assistance to those in need, family caregivers whose own lives are often disrupted or put on hold while they care for a loved one. So would you describe how the CLASS program would affect and benefit individuals such as family members?
Family caregivers in specific, as you know, probably know from talking to your constituents, family caregiving is a tremendous burden, both physically and financially. One of the ways that the CLASS program would help would be provide the family member themselves with cash benefits so that they could purchase assistance, respite care, the kinds of things right now that are often borne by family caregivers, both in terms of physical work and expense to provide care to their loved one.
One more question, or comment in question. There's a notion that the CLASS program won't work because there's no room for it, and that is because the existence of a private market, as limited as it is, provides that the potential market for long-term care is limited. The fact that there isn't more of a market for it, it must mean that people don't want this. Yet this fails to take in consideration that government programs often spur private markets. For example, the implementation of Medicare led to the creation of what is now a successful Medigap market. As the former general counsel for the Kansas Insurance Department, how do you see the CLASS program impacting the private market? Do you see any room for collaboration? Do you think this will be a growth industry in the future?
Thank you. As I mentioned earlier, the private market has been around for about 30 years. They started with comprehensive nursing home insurance and then added and changed really to include community-based services. But it's always been designed to be a comprehensive product. Nothing like the CLASS program has ever existed in the private market. So these are complementary but different markets, and I think there is plenty of both need and room for both to exist as we move forward.
Thank you very much.
The gentlelady's time has expired. The chair recognizes the gentleman from Pennsylvania, Dr. Murphy, for 5 minutes for question.
Thank you, Madam Secretary. I appreciate my comments, the comments of my colleagues about good intentions, and all of us want to make sure that those who are disabled have the care that they need. But good intentions do not necessarily cause good law. And I may intend to pay all my bills, but if I don't, the bank isn't going to accept my intentions as reason to not foreclose on my home or my car. So it is important that we have these numbers, and I appreciate your patience in helping us understand this. With regard to the health care bill, the latest CBO and Joint Commission on Taxation estimates are that for the first decade on the health care bill, it would cause a net increase in federal deficits of $210 billion of the period of 2012 to 2021. Now, last March, the CBO and JCT estimated that it would actually be $124 billion. It would reduce deficits. So we're off here by almost $300 billion in those estimates. They also note that the repeal of the Class Act provisions would increase federal deficits by $86 billion, meaning that that money was counted as part to pay the bills for the health care bill. For the first 5 years, I believe the revenue would be collected from people on a voluntary basis as long as they didn't opt out. And that, am I correct on that?
You are correct on that, yes.
And that would be a defined contribution. You would set the rates of what someone would pay. Am I correct?
Yes.
And it's a defined benefit of $50 a day. Am I correct at that?
There will be a defined benefit. That's what we're still developing.
We still don't know how much that'll be. Will there be lifetime caps on that?
We're working with the law, which says an average of $50 a day with a lifetime benefit in the product design. But I don't have specifics other than that to give you.
Well, given this information we have, that in order to pay for the health care bill overall, the other day Secretary Sebelius was speaking to us, and under questioning from Mr. Shimkus, she acknowledged that the health care bill, actually by borrowing the $500 billion from Medicare, really was double counting. That money was about to pay for the health care bill, but we still had to pay back Medicare. So I ask a similar question here. This money, which is going towards helping to offset the cost of the health care bill, is it also double counting?
Congressman, truthfully, I'm aware of the CBO budgeting process. My responsibility really is to help advise how we make this particular program solvent, and not. I don't do as much with what the CBO counting of the scoring would be, and certainly not for the overall bill.
I appreciate it, but isn't that money also being counted to offset the other healthcare costs of the rest of the bill?
As I understand the CBO scoring for the first 5 years, as you described, there would be money coming in, and that has been considered in the CBO scoring, as you've described.
So that is double counting. That money is also to help pay for the health care bill as well as to cover the Class Act.
I would have to go back to the CBO description, but that sounds accurate. But I just would refer back to what CBO did themselves to understand it.
So yes, it is double counting. I'm taking that as an answer. In that case, don't we have to pay back that money to cover the Class Act, that $80+ billion, and not just take it out? You also need that as you are going through to define the benefits and contributions and the caps. I'm assuming that you are hoping that money comes back and it isn't just taken out and it never returns.
Certainly, we will only move a program forward if there are premiums, and we have modeling to indicate that the premiums will cover the benefits as designed.
But
so
if
we,
they take
by
the 80
inference, are assuming that we will have premiums to collect and that they are accounted for in the federal government that we can draw upon to pay the benefits.
I'm trying to help you because you're going to have a very difficult job here. If $80+ billion is taken out to pay for health care, but you still need to have $80 billion in there to pay for your benefits, the question is, where is that money going to come from? And I liken it this way. If I went to the state of Pennsylvania and I said, I want to start up a long-term care insurance company, and so what I'm going to do is I'm going to collect benefits from people, but I'm going to spend that money on other things. But I promise you the day it starts, I'm going to have money to pay for that. I'm sure they would say, you're not going to do this, and if you try to, we're going to put you in jail because you don't have the money to do that. I think you have been given an impossible situation here where you're going to have to come up with this plan that someone has already taken $80+ billion to account for something else, and I hope there's a mechanism, I don't know what it is, where the money is going to come from to help you. Do you have any idea how that's going to work out?
Congressman, I'm understanding your questioning. To me, this is a difference between the budget methodology and the financial accounting that we need to do in order to run a solvent program. I have much more authority and responsibility with regard to the basic accounting and fundamental science of the plan.
I appreciate it.
In the budget.
And my concern is also for the people. I hate to promise people a benefit and then say, by the way, there's no money to pay for it, so we're going to have to raise your premiums, raise your copays, reduce your benefits, and set caps. That's concerning to me because it's a promise on cap. I'm out of time. Thank you.
The gentleman's time has expired. The chair recognizes the gentlelady from Illinois, Ms. Schakowsky, for 5 minutes requesting.
The gentleman just described exactly what we have with private insurance right now, that kind of uncertainty that is in the private market, and I have confidence that the Class Act will actually address this problem. I am happy to meet you and to see you here. I have been working on the issue of long-term care since I was in the state legislature starting in 1991 in Illinois, and helped to pass the Prevention from Spousal Impoverishment, that people didn't have to lose their homes, spend down every single asset in order to have their spouse go to a nursing home. the issue of the cost of long-term care, not just for persons with disabilities, who I see are here today, and I welcome them, but certainly for most families, or many families anyway, face this really frightening prospect right now of not being able to have the care that they need, having to move from one place to another, find some place that will accept Medicare. And so I wanted to, Mr. Chairman, put into the record and then refer to the National Council on Aging has top 10 reasons why conservatives should love the class program. And I would like unanimous consent to place this in the record.
Without objection, so ordered.
I wanted to go over a couple of them and welcome your comments. It says, 1, class provides flexibility to ensure fiscal solvency. And thanks to an amendment from former Senator Judd Gregg, the plan includes strong provisions to guarantee fiscal solvency for 75 years. Statutory language was purposefully written to provide flexibility in benefit design, eligibility triggers, and work requirements which help reduce adverse selection and ensure solvency. Wondered if you wanted to comment or expand or just assure its accuracy.
Congresswoman, the Secretary has the responsibility to guarantee solvency and the authority to make the adjustments that we need to in order to get us to that point. The amendment by Senator Gregg certainly gives us the guidepost that we must make sure that this is solvent in the long run for 75 years.
Okay,
and we will take those steps before we implement it.
Let me go to the second one. No federal tax funds will be used to pay benefits. Section 3208 states, quote, no taxpayer funds shall be used for payment of benefits under a class independent benefit plan, unquote.
That's correct. The premiums have to cover the benefits.
3, class has no mandates. It is optional for both employers and consumers.
That's correct.
Class will increase business productivity by reducing caregiver absenteeism and permitting people with disabilities to work. A recent survey found that 74% of caregivers have had to change their job or stop working because of their caregiving responsibilities.
Well, as you know, the main purpose of the law is to provide cash to an individual who needs assistance. There is a parallel there for additional support for the caregivers who are providing that assistance. Caregiving is a huge burden, and as we know, many people struggle to both maintain their own work and care for a loved one. So helping the person needing care will help both people.
All right. Americans across party lines strongly support class. Let me just give you some figures. The Kaiser Family Foundation poll in February, 74% of Americans support the program, only 20% opposed. Among independent voters, 75 support, 19 opposed among Republicans, 57 support, 36 oppose, a 21% margin. I'll go on 6. Class will jumpstart a flat private long-term care insurance market. I think you talked a bit about that. I know that Congresswoman Capps suggested that this actually could do this. I wanted to just give you one fact. When France implemented a proposal similar to class, sales of private plans increased annually by 15%, largely because the public debate increased awareness of long-term care risk. So you stated earlier that you hoped that and thought that would be the result?
Certainly, one of the major issues that we need to address, and that is part of the plan for the budget, is to market to the American public the problem that there is a need for support for long-term services. Class is one option. Private insurance would be another.
I'm going to skip to class will reduce the federal budget deficit by $86 billion over the next 10 years.
Yes, that was the CBO score.
Okay. My time has expired. Thank you.
Chair thanks, lady, and recognizes the gentleman from Ohio, Mr. Latta, for 5 minutes for questioning.
Well, thank you, Mr. Chairman, and Assistant Secretary, thanks very much for being here today. I greatly appreciate it. Just to kind of a line of questions that some of my other members have asked a little bit earlier, but maybe I could just follow up on. One is, I just want to make sure I understand. Did the Secretary say this at a Senate hearing? She remarked that the program will not start unless we can be absolutely certain that it will be solvent and self-sustaining into the future. Did she make that I just want to make sure
Yes.
I've got that correct. Okay. And also in your testimony, you stated on page 4, you said that President Obama and Secretary Sebelius have acknowledged that the class program needs improvement. Many of the changes proposed to the Senate Health Reform Bill that would have improved the class's program financial stability were not included in the final legislation reflected in the Congressional Budget Office assumptions that scored the class program. Therefore, it was not unexpected that the President's Fiscal Commission identified that these same unresolved issues in December and recommended reform or repeal of class. Given the critical unmet needs of long-term care that I noted earlier, we should not repeal class until we have made every effort to reform the program. And that was in your testimony. And the next question is it my understanding that the President is requesting in fiscal year 2012 $120 million?
That is correct.
Okay, and may I ask, what exactly does he want to spend the $120 million on?
$93.5 million would be for education and outreach efforts to both inform the public about the new program as well as the larger issue of the need for long-term care.
Okay,
the other two expenses are for administrative costs and IT.
Okay, let me ask this question. If we have a program that everybody acknowledges is broken, why do we want to spend money educating people on something that might not work in the present form? Let me give this as an example. If someone in the private market makes a defective product and puts it on the market, should that person have done that? If someone goes out and makes a defective product, knowingly knows that they put something out on the market that's defective, should they have done that?
We don't intend to market a defective product.
Well, okay. Well, let me ask this though: if we're going to educate people on $120 million on something that's broken, you know, in the private market, what would happen is we'd have every state attorney general, we'd have the ABCs of the federal government, we'd have private individuals filing class lawsuits against someone that would have done that. And so I guess it's you know, I'm not saying good or bad about this program. What I'm saying is, why do we in the federal government want to spend money on something that we already know right now isn't working, and we're going to go out and market it to tell people? Are we going to tell people this is defective? Are we, you know, should we use the statement from the secretary in her testimony before the Senate Finance hearing, saying the program will not start unless we can be absolutely certain that it will be solvent and self-sustaining into the future?
We've spent a year since the law was adopted analyzing through 2 actuarial models what the law would look like. And that led us to the conclusion that there are changes and improvements that we need to make so that we can go to market with a product.
Should that be the first statement we should put out in any notice to anybody? We should put a disclaimer, a caveat to the American people saying that this program will not start unless we can be certain that it will be solvent and self-sustaining into the future.
I think we should tell the American public that this program will be solvent because we won't start it if we will, and provide them information so they know what they're participating in if they choose to.
You know, and again, though, I guess maybe my logic's off here, but that we're going to spend money on something out there that's defective. Shouldn't we first improve the product, then market it?
To me, that's the description of what we're telling you that we're in the process of doing, that we did the initial modeling. There are improvements that we need to make. Both the President and the Secretary have discussed that in terms of reform in response to the Debt Commission, and that we will not, again, using your language, go to market until those improvements are made and we know it's solid.
Okay, do you all have the authority to make all the reforms in it beforehand?
There are between 35 and 40 different places in the law where the Secretary is given both authority and responsibility to make the program work.
Do you have to come back to Congress? Do you have any reforms implemented?
No, we don't have any proposals at this point.
But at the same time, we're going to spend $120 million. And how long do you think it's going to be before you could go out to market and actually have a product that people can say that on our side that it is something that's totally done, that we don't have to worry about telling people that it's not incorrect?
The statute requires the Secretary to publish a final plan in October 2012, and we will hit that marker and have a product at that point that we could support and go to market shortly after that. That is the schedule described in the law.
Thank you, Mr. Chairman.
The gentleman's time has expired. Chair recognizes the gentleman from New York, Mr. Weiner, for 5 minutes for questions.
Thank you, Mr. Chairman. This morning I woke up to a phone call from my brother, Jason, who told me that my mom, who's 75 years old, who skis every weekend and who takes long walks, tries not to drive anywhere, walks up and down her stairs, and actually lives in a 4-story walk-up, had to be taken to the doctor because she fell. Jason's going to eventually have to go to work. I have to figure out whether I'm going to be able to cast votes tonight because I'm going to have to run home to see if I can take care of her when she gets done with the doctor. Nothing remarkable about this story.
No.
Every single day, people are trying to figure out how you deal with an increasingly healthy, longer-living, aging society, something we should be very proud of, something that was largely the result of the Medicare Act, which many people objected to. They said it's socialized medicine. What are we doing? We should stay out of people's business. Well, we created that program. Now we have healthier people, and a lot of them women, because husbands die by, actuarially die earlier, so a lot of women, like my mother. She didn't choose to fall and hurt her hip. No one chooses to have Alzheimer's because they're Democrat or Republican. No one gets up one morning and says, the free market leads me to decide that today I'm going to go shopping for a broken hip. That doesn't happen. There's an expression that it takes a great man to build a barn, but any jackass can kick one down. In this case, a great woman to build a barn. In this case, my friends on the other side of the aisle are kicking down their own barn. They're the ones that have continually said throughout the healthcare debate, well, if you just give people money back and let them decide the smart way to spend it, then that's the way to structure a program. That's what the Class Act did. That's what the Class Act, it imbued the idea that my friends had. And yet here they are saying, you know what, we can't do that. Now it's funny how they all stipulate so comfortingly, oh, of course it's a big problem. Oh, yes, it's a very big problem. Because they know every one of their constituents literally sits in anxiety like I do and like my brother are. How are we going to balance this? We don't want my mother to be in an institution. That would cost a great deal, and she doesn't really need it. But how do we provide this seam of care? I'm very lucky. Jason's very lucky. We're both gainfully employed. We have some flexibility. But what about the families that don't? They know that it's not a partisan thing about whether your loved one gets sick. It's not a party thing. If we can step back for one moment and say, well, wait a minute. If we all concede and stipulate that this is a problem that needs to be solved, let's think of the foundation on how we try to solve it. Now, I believe in a single-payer system like Medicare that covers things like this, that covers people 65 and older, but also covers 55 and also covers 35 and 45. I believe in that. Now, some of my Republican friends say, no, we don't believe in that. We don't like Medicare. We don't like programs like it. We believe in the private model. Let's double down on private insurance. And so, Secretary Greenlee, you're here to say, well, we've come up with a program that tries to address something you stipulate as a need in a model that you stipulate you like more, doesn't have a guaranteed anything except that we're going to try to make sure everyone gets at least $50 a day. And now we're saying, oh, this is a very big problem, but we don't like this idea. We don't like this one. Okay, where's your idea? Well, we already heard earlier there is no Republican idea. This is entirely a deconstructionist agenda. And I want to say to my friends and to my colleagues, for 99% of the American public, they see politics as kind of this white noise in their background. They just want to tune in every once in a while and say, you know what? All right, they get it. They watch this debate today on C-SPAN 6 or whatever it's on. They watch this debate today, and they listen to you say, well, I want to see a guarantee that it works. Well, if you are dealing with a loved one who has hurt themselves and needs care and needs to be taken care of maybe for the first time in your life, you're not thinking that way. You're thinking, you know what, let's see if we can try to help out a little bit. And we have to return to this place where we try to solve problems, not constantly deconstruct the solutions that other people are coming up with. And I say to my colleagues on the other side, oh, good and decent people, God willing, you live that life where none of your senior loved ones get sick. God willing. I wish that to you. But in the off chance that one of your constituents, even one of them, faces this problem, let's try to come up with a solution. And we're bludgeoning this poor person who's trying to say, you know what, I stipulate to the idea. It might not be perfect. This is a tough challenge. We're trying to fix it. We're using a model that you suggested, using flexibility that you demanded, and we're trying our best, and we're committed to trying to solve the problems. And what's the answer? Oh, you can't say with metaphysical certitude you don't solve the problems today before you leave the room? Well, in that case, let's hear from the four panelists who we paid to come here to say this program stinks. Let's listen to them. That ain't the way to run a country.
The chair will ask the audience to please restrain themselves. Gentleman's time's expired. Chair recognizes the gentleman from Georgia, Dr. Gingrey, for 5 minutes for question.
Mr. Chairman, thank you. And I'll take a lot of my time to maybe give a speech as well. And even if the audience were permitted their applause, I'm not sure that I would get any, but I will take the privilege anyway. Let me just say this, that my friend from New York, made a comment in regard to this side of the aisle being in opposition to Medicare and Medicaid and S-chip, and he didn't say it, but probably Social Security as well, and that's absolutely not true. That is absolutely not true. I've spent my whole adult professional life practicing medicine, 31 years, and I was a freshman in medical school when Medicare passed, and so this side of the aisle truly believes in the importance of the safety net programs that we have. But we also firmly believe, Madam Secretary, that we need to pay for these programs. And if we don't, and if we use gimmicks, and certainly we feel and can point to the evidence in the Patient Protection Affordable Care Act that there was a funny accounting used, double counting. We brought that out a number of times in this particular hearing. And all of this is what leads to $14.3 trillion worth of debt and deficits of $1.63 trillion, and the need to raise taxes in the President's current budget that he submitted to us last month by $1.6 trillion. So, you go off a cliff. As important as these programs are, and I've talked to some of you between the break, and I understand that this Class Act has great merit and maybe some potential, but clearly with this double counting, the gentleman from Pennsylvania on our side brought that up, and I'm going to bring it up again, Madam Secretary, because this is the kind of thing that is wrecking this country and pushing us toward the precipice of bankruptcy. And so that's why we say if a program like this doesn't work, don't start it. And I plead with you not to do that. I wish this bill was a standalone provision that we could really vet and make sure before we started anything like this that it was not just another situation where you have the big federal government raiding the trust funds, whether it's Social Security or Medicare. So let me, Madam Secretary, address that once again. My numbers say that the CBO found that something like $39 billion. Mr. Murphy had a higher number, a figure. The total cost of Obamacare would be paid for by the total net savings from the Class Act. So do you know why CBO, again, he asked you that question, I'll give you a second opportunity to answer it, why the CBO counted the $39 billion toward paying for Obamacare? And yet you say the importance of raising that money early before this program goes into effect in essentially 5 years. Where's that money going to come from when it's needed for these seniors that Mr. Weiner and others are compassionately talking about?
Congressman, I hope to be able to describe accurately to you how I believe the program will operate. I don't have any involvement with the CBO scoring, and I know that's something that you realize. The money will be collected for a number of years, 5 years before the money is paid back out. And it's clear that there will be an obligation to the American public that they've paid premiums, we will pay their benefits. I'm simply not involved in the CBO scoring process or how the budget impacts the actual accounting of the program. We will make sure the accounting works. And continue to be involved, follow up with you if there's something that we need to readdress with regard to the CBO.
Well, Madam Secretary, you've said that a number of times, and I appreciate that, and I think you're very honest in your testimony, and being an honest woman and somebody with a lot of experience going back to your days in Kansas, do you think it's fair for the administration to spend whatever dollar amount, whether it's $40 billion or $80 billion, that put into the Class Act Trust Fund and then take it out and use it as part of the CBO score to make the Obamacare numbers work?
I just don't have a comment on that, sir.
Well, Madam Secretary, let me go a little bit further on that and say this. The Secretary of Health and Human Services has stated that she has the regulatory authority to make changes to this program. Do you believe under that authority that she has the ability to increase the program's income eligibility standards? It is a fairly straightforward yes or no question, and I think my time is about to expire. Yes or no?
Yes, there are requirements in the law she must follow, but she has the authority to do that.
Mr. Chairman, if you will bear with me just for a second, then I would like to ask you, unanimous consent, to put in the congressional record this CRS report that questions whether or not the Secretary has that authority, and that questions the overall viability of the program, and I admit this to the record.
Without objection, so ordered.
I yield back. Thank you.
Gentleman's time has expired. The chair recognizes the gentleman from New York, Mr. Towns, for 5 minutes for questioning.
Thank you very much, Mr. Chairman and Ranking Member, for holding this hearing. We have long agreed that our community, our country simply does not have an established framework to provide long-term care for those in need. Nursing home care is extremely expensive. When paid for by Medicaid, taxpayers are spending over $200 per person per day on these expenditures. At a time when both the federal and state budgets are extremely tight, we need to be looking for ways to alleviate these issues. Programs like CLASS can pose one solution, so long as we can work together to ensure that it remains financially sound. Let me ask you, Ms. Greenlee, what is HHS doing to ensure the fiscal soundness of this program? Now, this question might have been asked. I'm sorry.
I'm certainly willing to answer. Since the law was passed a year ago, we have been involved in putting together 2 different actuarial models so that we can check them against each other to determine kind of how the program works from an actuarial point of view. It's from those models that we've come to the conclusion that we need to make some changes to the program. We will now move forward using the new assumptions so that we can develop the plans that we need to prepare for presentation to the Advisory Council and to the Secretary. All of that will be a very public and transparent process. So we continue to move forward and build on what we've learned so far.
Yeah. Thank you very much. You mentioned in your written testimony that many of the changes proposed to the Senate Health Reform Bill that would have improved the CLASS program, financial stability, were not included in the final legislation. Can you give me at least a few examples?
Indexing of the premiums would be
Yes.
one example. I was not a participant in those conversations. As we've come to the conclusion that we need to make some changes, revisiting that Senate list was the first place we looked for ideas, and some of those things on the list are ones that we're proposing now.
Right. Mr. Chairman, we're getting a lot of criticism, on the other side. And it bothers me because I'm not getting any suggestions or ideas, from the other side, when it's a known fact that people are now living longer and they need this care at the end of their days. And if we're not going to work together to come up with some ideas, how do we reject what's already there? I mean, I just want to get a little answer from that, because I'm really troubled because this is a very serious issue, and I'm not sure it's been treated in a serious fashion. And I direct that to you, Mr. Chairman, not to the witness on this one.
Mr. Chairman, Mr. Towns, if you'll yield to me.
I'd be delighted to. I'll yield to anybody that might be able to help us.
Well, I appreciate it, and I think in my time and the remarks that I made and the questions that I asked of the Secretary is to further outline and shine a little light on the fact that we are very much concerned, Mr. Towns, in regard not this program. If it were standalone and we could get it right,
Will the gentleman yield? Well, I appreciate the gentleman yielding. I mean, the fact of the matter is we had 75 hours of hearings, hours and hours of markups, and basically every single time it was greeted with, no, we're against it. You know, you can, and Mr. Towns, you are correct in pointing out, they don't have this repeal and replace as a fiction. It's just repeal. Earlier, you missed it. Dr. Burgess said, no, we don't have a bill. I would ask Dr. Gingrey, is there a bill? We'll take a look at it right now. Let's hold it up and take a look at it. It would take you a very long time. They say read the bill. It won't even take you much time to read their bill, Mr. Towns. They don't have one. They're bankrupt of ideas, but they do know that for all the people that are going to get care under the Class Act, they want them to be out of luck. That is clear, Mr. Towns, and I yield back to you.
I thank you, gentlemen, and I must admit that I agree with your statement, and I think it's unfortunate because this is a very serious issue, and I don't think it's been handled in a very serious fashion, and that bothers me.
Will the gentleman yield?
I'd be delighted to yield. I'll yield. Do you have any kind of solution?
Well,
if you do, I'll yield to you.
Well, the solution is the hearing that we're having today, but I would just point out this is a hearing that we were promised when we marked the bill up in the middle of the night without having a hearing on this subject. And Chairman Pallone at that time promised a hearing after the bill passed. That seemed odd to me, but I was willing to go along with it. Well, now we're having the hearing. But unfortunately, the bill was passed and signed into law. And as we know, the Gregg Amendment over in the Senate, as this thing was slapped together at the last minute, the Gregg Amendment did protect the draw on the Treasury, but that can be overridden by the Secretary of Health and Human Services. Is that not correct?
The gentleman's time's expired. Chair thanks, gentlemen, and yields 5 minutes to the gentleman, Mr. Guthrie from Kentucky, for questions.
Thank you, Mr. Chairman. I appreciate that. And we are concerned. People do have issues when they're older, and we need to prepare financially for that. We need to set up and financially for that. And like all the members here, willing to work with whoever we need to help people. People can't use health savings account. They can't use pre-tax dollars for long-term planning, and that's where we need to go with it. But on the premium side of it, as we looked at, if you look at the questions we're asking, I mean, Kentucky today, the legislature's in General Assembly is in special session to close a $100 million gap in Medicare and looking at cutting education to do so. So when something passes and the Secretary of Health and Human Services says add in its current form is not solvent, I think it would be absolutely irresponsible for us, seeing what's happening in the budget, not to sit down and ask these questions. And you're giving some answers that are comforting. A couple of things. One, on the premium, it's going to be self-sustaining, so the premium that goes in pays the benefit.
That's correct.
And so there's no, the premium may be high. That's the question once you start figuring out what it's going to be. Maybe, if it's unaffordable, it won't be any, well, we're going to save Medicaid here, therefore we can book. The law doesn't allow you to book, to say this premium will pay this, but there's a gap, but we're going to have savings in Medicaid, therefore it's a self-funding program. You know what I'm saying? Just booking savings in other categories to...
No, it's the analysis is self-contained within the Class Act itself. I mean, the Medicaid savings are important to watch, but they don't in some way offset what's happening within the class program itself.
Now, if I understand this, the first 5 years people will pay in, but you can't receive a benefit for 5 years because you have to pay in 5 years to receive a benefit.
That's correct.
So the money paid in has been scored to support other parts of the health care bill.
Yes.
So when you say a premium is going to pay benefit, you have to account for that? Because that money's not going to be there in year 5 to pay, so the premium will have to be higher to cover the benefits in the Class Act alone because you're taking money out to subsidize something else, right?
This is,
you got to factor that into the
as I described earlier, the difference between budgeting and a budgeting process and the accounting that we have to do in the receipts and the expenditures in the class program itself. They are not the same thing. They are related, but they are not the same thing in terms of the solvency of the program.
Well, I know you're not budgeting, but I know you're not CBO, but you're going to have to account in the value of the premium for the fact you're not going to have the first 5 years of dollars to spend for benefit.
No, the program must be credited with the premiums that come in.
Okay. So you're going to count the premiums that's spent somewhere else as part of the benefit?
It'll have
You're not
to
going to have the money there.
But it has to be a part of the accounting that we make for the program.
Okay.
I mean, it's very clear in the law that the premiums that come in have to cover the benefits, and there will be a request for benefits. I mean, that's the program design. If there's a budget methodology that accounts for that in a different way, it does not change the fundamental soundness
somehow we're going
of
to
the
have to come
program.
up with the first 5 years of money.
5 years it'll be there, but this again is these are kind of different financial mechanisms that we're interchanging.
So I've worked in family business and provide benefits to our workers and look for ways for people to get planned for their long-term care. If a business doesn't auto-enroll, is there going to be there's an alternative process to enroll individuals? If a business chooses not to offer it as a auto-enroll benefit, then what's the alternative process?
The key here is that both the employers and the individuals have choice. The law describes an employer opt-in methodology, which is up to the employer if they want to participate. And we also have to come up with an individual or an alternative mechanism for individuals. We are seriously interested in engaging the business community about what would work for them. If they choose not to opt in, are there other kinds of information, other kinds of ways that they could help their employees gain access to the program? And we will be engaged with the employer community in a robust fashion because their support is helpful to us as we gain the large numbers of participants.
Well, that's the easiest way to reach access.
That's how we get the numbers.
That's where they show up
we
every
need
day to work. It's like when you do immunizations, you get them at school because you know you're going to get everybody coming in.
And we need to be engaged with them and plan to do that.
On the I got just about a minute, but you have I understand when you have the 3 months, so you don't want to pay in early, drop out, and then get back in and try to get in at your early rate. So if you drop out for 3 months, then you come back, you're reassessed at the age and the time, and the actuarially at the time you come back in. So if you buy a policy at 20, it should be cheaper than if you buy a policy when you're 60 because you've got longer to, hopefully, unless you're disabled, to have longer time to pay. So currently we've had people on unemployment for 2 years. So we have these kind of situations, but if somebody dropped out, lost their job, and couldn't get a job for 3 months and a day, when they show back up, they would be reassessed at their new age. So if they started at 20, they get 40, they lose their job, they come back at 40. 3 months and a day later, they get reassessed. Is that how?
There are two things we have to achieve together in that.
I mean, that's just a real issue. That's
right.
Right
is
now,
that the fact that people
yeah.
may come in and out of the program in a very legitimate way that we need to price, but we also need to protect from gaming the program at the same time.
Thanks. Appreciate it.
Gentleman's time has expired. Madam Secretary, thank you for your testimony and your response to the questions. Earlier this month, Secretary Sebelius promised Dr. Gingrey during her testimony before this committee that HHS would engage in a transparent process in the development of the class program. My hope is that you will share information with this committee as you develop the program's structure.
Yes.
Thank you. And that concludes the first panel, and the Chair thanks the Secretary for your very informative testimony and responses.
Mr. Chairman?
Yes. Chairman.
Very briefly, thank you for having this hearing. It has been very useful, and it is moving us towards seeing to it this program works well. This is the purpose for which oversight was designed, and it is our responsibility, and I commend you for it. Thank you.
Thank you, Mr. Dingell, for those comments. So you're excused this time, and we'll call the second panel to sit at the table, and I'll introduce them at this time. Testifying on this one. I'm introducing Mr. Smith and Trust. All right, thank you. And let me introduce the witnesses, and they'll testify in this order. And I ask that they will summarize with 5-minute statements each. We'll make your written testimony part of the record. First of all, Mr. Alan Schmitz is a principal and consulting actuary with the Milwaukee office of Milliman, focusing primarily on long-term care insurance. Mr. Schmitz is was part of a team of actuaries from the American Academy of Actuaries that has provided actuarial analysis and review of the class program. Mr. Smith has also recently served on the Society of Actuaries Long-Term Care Insurance Section Council and currently leads the International Actuarial Association Long-Term Care Team. Dr. Joe Antis is Wilson H. Taylor Scholar in Health Care and Retirement Policy at the American Enterprise Institute. Dr. Antos is also a commissioner of the Maryland Health Services Cost Review Commission, a health advisor to the Congressional Budget Office, and an adjunct professor at the Gilling School of Global Public Health at the University of North Carolina at Chapel Hill. Before joining AEI, he was Assistant Director for Health and Human Resources at the Congressional Budget Office. Dr. Antos received his Ph.D. in economics from the University of Rochester. Mr. Warshawski currently serves as the Director of Retirement Research at Towers Watson, a global human capital consulting firm. He conducts and oversees research on employer-sponsored retirement programs and policies, Social Security, financial planning, and health care financing. In addition, Mr. Warshawski was confirmed by the Senate to serve as a member of the Social Security Advisory Board for a term through 2012, previously served as Assistant Secretary for Economic Policy at the U.S. Treasury Department. Mr. William Minix, Jr. has served as the President and CEO of Leading Age since 2001. Leading Age is an association of 5,400 not-for-profit organizations focused on advancing policies that support the empowerment of people to live fully as they age. For more than 35 years, Mr. Minix has been an advocate for innovation in not-for-profit aging services, and during his tenure with Leading Age established the Leading Age Center for Aging Services Technologies. Mr. Tony Young is the NISH Senior Public Policy Strategist addressing employment issues as they affect individuals with significant disabilities. Mr. Young is particularly involved with the Ability One program, whose mission is to provide employment opportunities for people who are blind or have severe disabilities in the manufacture and delivery of products and services to the federal government. In 1998, Mr. Young received the Disability Achievement Award by the American Public Health Association's Disability Forum. This award is given to a person who has a long history of making substantial achievements in the field of disability science or policy benefiting persons with disabilities. So welcome. We look forward to your testimony. And Mr. Schmitz, you're recognized for 5 minutes.
Thank you, Chairman Pitts and Ranking Member Pallone, for the opportunity to testify today. My name is Al Schmitz, and I'm here on behalf of the American Academy of Actuaries. We published an analysis of the Class Act legislation in 2009, which modeled an earlier version of the program. Based on that analysis, we concluded that the program would not be sustainable in the long term, and that it would be unlikely to cover more than a small percentage of the intended population. Those same concerns persist with CLASS program as enacted. The CLASS program is a voluntary, guaranteed issue, employment-based program. It's important to note that the CLASS program is required to be actuarially sound over a 75-year period with no support from taxpayers. Nevertheless, the actuarially sound requirement will be very difficult to achieve under the current program design. A primary concern is the considerable potential for adverse selection in this program. Without addressing many of the program's issues, the program will be unsustainable in the long term. An effective, actuarially sound public long-term care program will limit the effect of adverse selection. And this is critical in a voluntary program in which participants may opt in and opt out. Those with greater need for long-term care coverage are more likely to opt in, and those individuals without that need are more likely to opt out. This adverse selection increases the average insured risk and results in higher average premiums, which in turn may lead to less participation from healthy individuals and even more adverse selection. This can result in a premium spiral. Important provisions in the Class Act that affect adverse selection include guaranteed issue with a week actively at work requirement, opt-out and opt-in provisions that allow participants to delay coverage until it is needed, premium subsidies requiring a premium of only $5 per month for students and those below the poverty line, a waiting period that is not long enough to control adverse selection, rate increase limitations for certain individuals older than age 65, and benefit design features such as cash benefits and unlimited lifetime maximums that have been and continue to be problematic in the private long-term care insurance market because they're susceptible to induced demand and may drive higher premiums and lower participation. There has been significant focus on participation levels as a critical yardstick in measuring the viability and success of this program. And while higher participation generally makes it easier to obtain a reasonable spread of risk, it should be made clear that it is the mix of individuals with different risk characteristics enrolled in the program at any one time, and not participation alone, that is key to long-term sustainability. High participation from only higher risk individuals will threaten the program. Key factors influencing participation are affordability and marketing. The premium levels must be affordable, competitive with what is available in the private long-term care insurance market, and of good value to consumers. But the class program design includes features that increase adverse selection and result in relatively unaffordable premiums. A strong marketing program would significantly increase participation and aid in obtaining a reasonable spread of risk. In addition, it would encourage individuals to plan for their future long-term care needs. And getting people to plan for the future long-term care needs could help reduce pressure on government, which currently pays a majority of long-term care. A sustainable, voluntary program will have provisions to address many of the adverse selection concerns I have outlined. On behalf of the Academy, I offer the following recommendations for modifying the class program. An actively at work definition with a minimum requirement of 20 to 30 hours of scheduled work or comparable requirement. Restrictions on the ability to opt out and subsequently opt in with the use of either a long second waiting period or alternative underwriting mechanism. The use of benefit elimination period and duration limits. Benefits that are paid on a reimbursement rather than cash basis. And an initial premium structure that provides for scheduled premium increases at either consumer price index or alternative rate. These modifications, along with an effective marketing effort, will improve the sustainability of this voluntary long-term care program. Without these modifications, the program is likely to be unsustainable. We are encouraged that Congress and the administration are considering changes to the program that could help address adverse selection. Significant additional changes, however, are necessary to address the concerns I have raised here today, or the class program may not be sustainable. Again, I thank you for the opportunity to appear before you today and would welcome any questions.
Chair thanks, gentlemen, and recognizes Dr. Antos for 5 minutes.
Thank you, Mr. Chairman, and thank you, Ranking Member Pallone. CLASS is a new federal long-term care program that is financed solely through enrollee premiums. Because the program collects premiums in advance of benefit payments, CLASS reduces the budget deficit in the near term. Over the longer term, CLASS increases the deficit and worsens the fiscal crisis we are already facing due to the mounting costs of Medicare, Medicaid, and Social Security. The goals of CLASS are laudable. The program aims to provide persons with functional limitations cash assistance to help them remain living in their communities. But few people will benefit unless the program is attractive to a broad population who can share the cost and keep premiums affordable. CLASS will primarily enroll an older, sicker population, which will drive premiums up sharply. This adverse selection will create a death spiral of rising premiums and declining participation that will doom the program as it is now structured. The technical defects in CLASS arise from the intention to make long-term care benefits readily available, including to persons who already have disabilities but are still able to work. Underwriting is prohibited, and enrollees of the same age are charged with the same charged the same premium regardless of their health or disability status. Moreover, low-income people would pay a $5 monthly premium. Consequently, premiums for other enrollees will be high to begin with and grow rapidly as healthier people refuse coverage or drop out of the program. Automatic enrollment and the minimal work requirement will have very little impact on this situation. Premiums are hard to predict. CBO estimates that premiums would be $123 a month for a $75 a day benefit. The CMS chief actuary estimates $240. That tells you that there's fundamental uncertainty about what's going on with this program. By comparison, however, private premiums average about $184 for a daily benefit, somewhat larger than $150. There are differences, but nonetheless, that tells you something about the state of the market. With high-class premiums and better deals elsewhere, it is not surprising that participation is estimated at 2 to 3.5% of the market. It will soon become obvious to many workers that prompt enrollment in class is not in their best interest, even for those few who are actively interested in purchasing long-term care insurance. A 40-year-old who waits 10 years would save about $15,000 in premiums, with only a small risk of becoming unable to qualify for class by the time she reaches 50. Consequently, there will be few younger, healthier people in the program to subsidize those who will soon draw benefits. The law requires premiums to be set to keep the class trust fund solvent over 75 years. That guarantees steep price hikes as the mix of enrollees shifts towards those with greater risk. Even if solvency is achieved, the program will generate budget deficits in coming years. CBO says the deficit will appear sometime after 2030. The CMS actuary says 2025. The question is not whether there will be deficits, but rather when and how much. As with Medicare, the trust fund does nothing to protect the class program. Surpluses that accumulate in the fund are invested in non-marketable Treasury securities, essentially IOUs that obligate Treasury to find funds to cover the operation of class when premiums are no longer sufficient to cover expenses. That money is, of course, used, the surpluses are used immediately by the Treasury to fund the ongoing operations of the federal government. It's a standard operating procedure. Although premiums would be set to maintain a positive fund balance for 75 years, that balance includes the excess premiums from the first few years that were in fact spent, and it includes imputed interest on Treasury secretaries that is not in fact new money. If adverse selection is not addressed, class will face a funding crisis. Unless Congress reneges on a public promise and fails to pay benefits after having collected billions in premiums, it would have no choice but to provide a financial bailout rivaling anything we have seen to date. Congress could take action to mitigate adverse selection by, for example, toughening the work requirement or permitting some form of underwriting. I know that Secretary Sebelius has said that she has the authority to take the necessary actions, and the CRS analysis that was introduced strongly indicates that that is not the case. Congress could also ignore the structural defects of class and force workers to buy it, despite the fact that very few people now buy long-term care insurance today, which says something about how people view the situation, regardless of what we analysts think is right. There's no guarantee that even legislative changes, even dramatic legislative changes, can cure the class program's serious defects. Repeal is a logical alternative. It is far better as a public policy matter to repeal a defective program than to let it repeal itself through fiscal failure.
Chair thanks the gentleman and recognizes the gentleman, Mr. Wachowski, for 5 minutes.
Chairman Pitts, Ranking Member Pallone, other members of the subcommittee, I appreciate the opportunity to share information and thoughts with you on the new voluntary long-term care insurance program to be offered by the federal government in 2012 called CLASS. I'm Director of Retirement Research at Towers Watson, a firm consulting on employee benefits and a member of the Social Security Advisory Board. In this testimony, however, I'm not representing either organization. Rather, I'm speaking as somebody who has done research and written on long-term care insurance and disability risk for more than 15 years, and most recently about the class legislation. In this statement, I hope to set forward a framework that could be used by employers in deciding whether or not to participate in the class program. First, however, I thought it would be helpful to provide some statistics about current offerings of private long-term care insurance by employers to workers. According to our benefits data source at Towers Watson, as of 2010, about 50% of large employers offer but do not subsidize long-term care insurance to their workers. Another 4% provide such insurance with either a partial or full subsidy. The fact that the vast majority of employers either do not subsidize or even offer long-term care insurance to their workers, despite a tax advantage to the worker from any employer subsidy, reflects that this insurance is considered a convenience benefit to employees. That is, long-term care insurance is not a core benefit for employers because it's not thought to provide a significant business advantage to the employer, offering it beyond goodwill and convenience to the employees. Moreover, experience to date with take-up by employees and employer-offered long-term care insurance plans has been quite modest. Even in large organizations with well-paid and well-informed employees for whom Medicaid is unlikely to be thought a source of long-term care coverage, take-up rates have not exceeded 5 or 6%, and that's at the upper end of the spectrum. This is despite the fact that employer-offered policies have the advantage over commercial individual policies that little or no underwriting is done in the workplace. We've had extensive discussion about the intended structure of the class program, so I won't go into that, but I will note that the one aspect is that it provides that workers can be enrolled in the program via one of two methods. The employers who can decide to participate in the program would automatically enroll their workers through payroll deduction, with the workers having the right to opt out. Such automatic enrollment is now common in many 401k plans. Self-employed workers and those whose employers do not participate could join through an individual enrollment mechanism. According to my understanding of the language of the law, employers could only participate in the program if they agreed to automatically enroll their employees. Also, according to my understanding of the legislative expectations of the program and the score given to the program by the CBO, as part of the broader health reform legislation, it is thought that most of the enrollment in the program, projected by the CBO to be 6% of the nation's working population in 2010, will be through employers. Now the framework, and I'll have to be quick. The overall important consideration to employers is whether the government aggressively promotes the need and the benefits of long-term care insurance per se directly with workers. In other words, they have to make a sale to the American public that this is the right thing to do as a long-term care insurance benefit. For example, is it possible for the government to add informative and candid inserts into regular communications that workers get from the federal government? Absent such promotions, many employers, even those currently offering long-term care insurance, are unlikely to want to participate in an automatic enrollment program when the vast majority of workers are likely to opt out. I have in my testimony a discussion of the adverse selection problem, which would concern employers as well, but I think that's been very accurately and ably discussed. So let me discuss in terms of some benefits and drawbacks of the federal program per se. Obviously, the employers will be comparing the benefits and premiums and administration of the federal program with those available in the private sector. This will be an intensely facts and circumstances evaluation, and I can't speculate on how it will come out. But there are sort of two opposing factors. One would favor the government program and others favor the private long-term care insurance. The fact that the government program pays cash benefits that can be used for any purpose, I think, is an attractive feature of the program because it provides flexibility. But the level of benefits that are contemplated in the government program, $50 to $75 a day, is unlikely to cover the actual cost of care for many disabilities, nursing home, home health care. But in private insurance, that is a parameter in the policy and can be selected to be appropriate to the region of the country and the level of care desired by the insured. Also, an advantage to the private insurance is that there is no 5-year waiting period. Let me conclude by saying that class program employers will need to evaluate at the time whether to offer it to their workers on an automatic enrollment basis. And it's worth noting that employers have a lot on their plate at this time with health care reform, and so this is just another issue.
Chair, thanks, gentlemen, and recognize Mr. Minix for 5 minutes.
Thank you, Mr. Chairman. Thank you, Mr. Chairman, and I want to thank especially Congressman Dingell and Congressman Pallone for their leadership on this issue. My organization represents not-for-profit aging services sector. They've been in your communities on average for 75 years. They're the Jewish and Catholic and Lutheran and Masonic and labor-sponsored organizations. We joined with a large coalition. I want to remind everyone there were 270 consumer service organizations that supported class. Senator Dodd said as far as he knew that was unprecedented. So we come to the table today with a lot of people that want this program. Why? Because they see the need for it inside out. Long-term care is something most families will face and nobody wants to talk about. We've been discussing risk. Here's where the big risk is. It's the single biggest risk that most American families face today. Just ask those that have been through it and they're not insured for it. So it's hard to talk about, but who will benefit from class is potentially every American family. Disabling conditions are no respecter of political party, age, socioeconomic status, living venue, background, genetics, what have you. It's the 20-year-old that took the dive at Beach Week and is now a paraplegic. It's the veteran who comes back from the war as a double amputee. It's the Alzheimer's person who moves in with the family. Families spend 35 hours a week caregiving, and that mostly involves women who also work full-time. They spend on average out of their own pockets $5,500 a year in that job, $9,000 if they're a long-distance caregiver. So Mr. Weiner's situation is becoming more and more commonplace. Those who are poor or have to spend down, we do have Medicaid, and we need to do all we can do to make sure Medicaid is there for people who need it. For private long-term care insurance, I own it, just like Dr. Burgess. I bought it 10 years ago. My wife couldn't get it through no fault of her own. My premiums just went up 60%. I can't wait for class to roll out for me and my wife. Every poll or focus group I've seen about class, when you ask real people, Democrat, Republican, especially women, say the time has come for a program like this. We need a choice not available in the marketplace. What's wrong with giving people a chance to choose something that may help them, because the options they have today are simply not there for the masses. So when we talk about risk, we better be talking about the risk of real people trying to live out their lives every single day. Now, who will benefit from class? Consumers, we've talked about. The taxpayer, it is a self-contained program. Business will benefit from it. We've had discussions with the business community. MetLife study says that it's costing business, caregiving is costing business $17 billion a year. And when I talk to business leaders, many of them say, you know, we know this is happening, but we're really not sure about what to do about it. Part of Advanced Class, which is a group that formed out of these 270 groups, is committed over the next several years to educating the public. This 270 groups touches the lives, has communication with tens of millions of people every year, and one of the things that is paramount for all of us to do over the next several years is educate the public, because the more people enroll, the better the effect on Medicaid. It puts money back in families' pockets that are willing to assume responsibility for caregiving, and it will help the taxpayer. It also will help business, because whether we like it or not, the need for caregiving is not going away. It will increase. You know the history of class, and we've had on both sides of the aisle conversations about this as ad nauseum. The biggest unknowns about class, the biggest one is that no one can be sure how many people will sign up. I heard Secretary Greenlee say they're going to roll out a plan, and that is the actuarial study we ought to all be looking at, because the day the plan rolls out and you can say, here's what it looks like, here are the options, here are the premiums, then we've all got a big education role. The biggest risk is status quo, doing nothing. The risk of moving forward with class is minimal compared to what we face otherwise. And thank you for your interest in this issue.
Chair thanks the gentleman and recognizes Mr. Young for 5 minutes.
Good morning.
Good morning.
Am I close enough to this microphone?
No.
Yep. that better? Okay. Microphones and I don't get along well. Good morning, Chairman Pitts, Ranking Member Pallone, and members of the Health Subcommittee. I'm Tony Young, as you know, Senior Public Policy Strategist with NISH. I work in a program called the Ability One program, and we assist people with very significant disabilities and blindness to obtain jobs through federal contracting. In FY 2009, the Ability One program helped over 47,000 people who are blind or have severe disabilities obtain employment. A national voluntary class program can help individuals and their families manage the impact when a sudden, unexpected event results in a lifelong need for assistance with basic human functions. Such an event can happen to anyone, at any time, and most who learn they need long-term services and supports have few options for financing that care. Many try to rely on their own resources or on help from family members for the care. However, unless they are extremely wealthy or they have very good dedicated family support, they will not be prepared for the financial and emotional costs. That is why I am here today. My experience demonstrates the need of a national voluntary class program. I was 18 when I acquired my disability while body surfing. In high school, I was very active in sports, lettering in football and track, even selected second team All-Met right guard for the Washington Post. There were social clubs, school activities, summer jobs, dating, dancing, pool parties, and preparing for college. It all ended abruptly and without warning on a hot summer day in August 1970. I went from near total independence to near total dependence in the crunch of a C4 vertebrae. After 10 months of medical and physical rehabilitation, I was sent home to live with my parents. There was no information available on how or where to get help. There were long months when my parents managed all of my personal assistance while working full-time. We were fortunate enough to have good health insurance at that time, so that medical bills did not bankrupt the family. This continued for nearly 3 years. Slowly, we discovered that some services were available. They came from a local visiting nurse service. I received home visits for personal care, physical and occupational therapy, and medical monitoring. These services helped to relieve some of the personal care burdens of my family, but it soon became apparent that I needed more flexibility and more responsive supports as they aged. There are 3 things I would like you to keep in mind during my testimony today. First, I am one of the fortunate few. I was not forced to go into a nursing home. I was not forced to become impoverished in order to be eligible for Medicaid. I was able to obtain long-term supports and services I needed. I had great family support, a solid education, close friends, and had worked up the SSDI and Medicare eligible. It was one combination of family support and early health development that made it so that I could live through that time and build a foundation and eventually go back to work. That program is a huge step forward for the nation. It offers a solution to all of us who want to help finance the challenges that lie ahead in preparing for unexpected events. I wish the class program had been available to me as an 18-year-old student and to my family prior to the accident. Had someone like me had class coverage prior to such an unexpected life-changing accident, my family and I would have some security that the personal assistance and long-term supports I needed would be available to us. I want the opportunity for my wife and eventually my son to plan for a future disability. 3, keep in mind that a person born with a disability, one who acquires a disability in adult life or develops disabilities in latter life, are not automatically triggered into the class benefits. In order to trigger benefits, an individual must meet a threshold of functional limitations. There are different thresholds and different benefit levels depending on the level of limitations. Some individuals will choose not to trigger the benefits at all. One more paragraph, I'll wrap it up.
Okay.
I know that some of you have concerns over the solvency of the program. Believe me, I want and need CLASS to be solvent too. I want it for my family and for millions of other Americans. So that they start again. I want it for my family and for millions of other Americans to have a sustainable program for the future. As we have already heard today, the HHS Secretary has authority, indeed the responsibility, to ensure that the program is solvent for 75 years. The Secretary has announced important steps to ensure the sustainability of the CLASS program by addressing earnings minimum levels, adjusting premium levels to account for inflation, and strengthening fraud, abuse, and waste loopholes that might threaten the program. These reforms are important to the program, and I believe that the Secretary must be given the time to make these and other changes to strengthen the CLASS program. Thank you.
Chair, thanks the gentleman. And we'll start questioning. Yield myself 5 minutes for questioning. Dr. Antos, during congressional debate on health care reform, we heard bipartisan concerns with the structure of the CLASS program. We have repeatedly heard Senator Conrad's, quote, regularly calling the program a Ponzi scheme. Could you please explain the budget gimmick that was used to claim program savings, even though by most accounts this program will significantly add to the nation's deficit?
Thank you, Mr. Chairman. Well, I think it's a time-honored tradition in Congress to use this particular technique, so I wouldn't want to call it a gimmick. But the fact is that premiums will be collected for the first 5 years before any benefits are paid, and there's a 5-year vesting period, so that means even, and I wasn't clear when the program will begin, but suppose it starts next year, even after 2017 or 2018, there will still be premiums coming in from an individual before there's any possibility that they could draw down benefits. This idea of collecting the money in advance and putting it in a trust fund is a well-known political concept, but it has nothing to do with budget rules. Trust funds are a separate kind of accounting mechanism. The budget follows essentially cash in and cash out. And so in the normal course of events with the government, while this trust fund will accumulate balances, that money is immediately dispersed to finance the other operations of the government. And eventually, when money needs to be drawn on that trust fund, the way it works is that the Treasury has to go to its usual sources to find the money, which is generally deficit financing, generally borrowing money from Americans and others who buy government securities.
Thank you, Mr. Schmitz. One of the challenges of long-term care insurance and health insurance is adverse selection, which occurs when insurance benefits attract a larger number of high-risk participants. The American Academy of Actuaries analysis noted that the CLASS program in its current form has the potential for adverse selection. Could you please speak to the potential magnitude of that selection and how such an effect could put the viability of the entire CLASS program at risk?
Sure. The adverse selection that's potential in the CLASS program as it's designed is driven by a number of things. It's going to be a voluntary program on a guaranteed issue basis. And to make a voluntary program work, there needs to be risk classification. You need to adhere to actuarial risk classification principles. And the way it's currently designed, the risk classification principles will not be followed because you'll have unhealthy individuals who will be more likely to join the program. So you end up with a situation not just because of initial selection, but also throughout the program. As healthy individuals, they may be the ones who decide to leave, and you end up with a group that the premiums end up rising, and you end up with a rate spiral. The other things that are important to look at with respect to this, in order to try to make this program work, there's going to have to be significant marketing of the program. That's going to be a critical piece in order to get the participation from healthy individuals that it's looking for. There also needs to be, there's a concern in terms of adverse selection as to what's available in the private long-term care insurance market, because right now there is not, the way class is designed. There's really not a good way to supplement the way it's structured. And so what's going to happen is the private market is going to end up competing with class. And so if there's an individual who's healthy, who's able to get underwritten in the private market, is perhaps married, the private market offers significant marital discounts, that individual is going to find a better deal in the private market. And so what you'll end up with is the more unhealthy individuals will end up in class, and so there'll be a problem with adverse selection from that perspective.
Chair, thanks, gentlemen, and yields 5 minutes to the ranking member, Ms. Palone, for questions.
Thank you, Mr. Chairman. I wanted to start with Mr. Minix. Basically, you pointed out that there are a lot of things that people pay out of pocket are not covered right now. I could give you, just from being a caretaker to my parents, that's certainly true. So, just explain to us, why we need class. In other words, what's wrong with Medicare? What are the limitations with Medicaid? What are the problems with private long-term insurance that, even if none of these alone can fully address the long-term needs of the elderly and disabled, and we know that in terms of allowing them to stay at home or in the community. What's wrong with a sort of mix and match approach to the problem, which is, I think, essentially what we're doing with class?
Sure. Well, Medicare covers acute and some post-acute needs on a limited basis till somebody is to the point, say, of they've rehabilitated to their maximum. And Medicare is a very good program in that regard. Then there are, but Medicare does not cover someone to come in inexpensively to help you get bathed and dressed, or someone to monitor your medications if you're living in your daughter's home.
Exactly.
Nobody pays for that. If you're fortunate enough to survive underwriting of private long-term care insurance and can afford it, okay, you've got some coverage there. And then there's Medicaid. We have a colleague at our work whose mother moved in with them. She would have been an ideal class kind of person, but obviously class wasn't in existence. The woman died. A week later, she was notified that she was number 176 on the waiting list for a Medicaid-eligible home and community-based services in her community. Well, that's just crazy. So what do regular people do? They patch it together, they sweat it out, they pool their money if they can, and class comes in beautifully to help look at that need. One of the issues we found in our studies is that young people have seen this in their own families, and one of the things we think is going to help in the marketplace is younger people, because what they've seen in their families may well be willing to say, you know what, I've seen it in my own family, I'm willing to pay premium. So we're excited about the opportunity of educating people to say, I want to get in this early.
Well, let me ask you this,
because they have a problem.
I want to ask another question of Mr. Young. But I mean, basically, in terms of who it targets, the funding mechanism, the benefit package, the things that you think we need to do you think the program is designed to achieve the goals and deal with some of these problems that you've spoken about?
I think the law provides a very good framework. And now what we have to do is see a final plan. And I think we've heard Assistant Secretary Greenlee and Secretary Sebelius say, and we support that. It ought to be a sound plan that it looks like a lot of people will buy into. I'm confident that both of those things will happen.
All right. Now let me ask Mr. Young, because you're talking from personal experience. What would you describe how the program could benefit your family, your wife, who works full-time, I believe? In other words, you talked about some of the problems that you've had and difficulties others had. Tell us how the class, once it goes into effect, is going to help, particularly with caregivers, not, both the patient, I guess, or as well as the caregivers.
Turn me off. The burden, the cost, I should say, of long-term services and supports goes well beyond what we pay out of pocket. I pay $17,000 a year now for about 18 hours of services in the morning and a couple of hours in the evening. All the rest of the support that I need, whether it's grocery shopping or laundry or preparing meals or work, hanging out with my son, any of those activities that makes a family go really fall on my wife. And for our purposes, a little extra would give us an opportunity to bring in that much more assistance that would ease her burden, give her some rest every once in a while. With a 6-year-old child and a C4 quadriplegic husband and a full-time job, she doesn't get much downtime. And even a little bit more would be very helpful.
Well, thank you. Thank you, Mr. Chairman.
Chair, thanks, gentlemen. Yields 5 minutes to Vice Chairman Dr. Burgess.
Thank you, Mr. Chairman. Dr. Antos, you talked or described, I think you called it a death spiral of increasing benefits, increasing premiums and decreasing benefits. What happens if you move too far out along that timeline? Will the Secretary have any ability to modify the program as you understand it if that scenario develops?
Well, Dr. Burgess, I think the prudent thing would be for the Secretary, if she has the authority, to make the changes now. I think there's considerable doubt about how much authority she does have to make the changes, and many of those changes would move in a direction that I believe folks who are looking forward to benefits from this program would find very negative, very unfavorable to them. But the fact is that you have to follow through. They have to follow through on what they said, which is they won't start the program unless it is fiscally sound. And that's not just a question of solvency in a trust fund. It's also a question of the impact on our deficit. And there's no requirement in the law that says that the Secretary has to worry about the deficit, just the trust fund. Correct. But when we say if the program is started, my understanding was the program has started, and the passage of the Patient Protection Affordable Care Act was predicated on the money coming in from the premiums paid into the Class Act. That's right, but since the regulation isn't coming out until sometime later, I'm not sure when, we don't really know all the details of how things will get started. That said, I believe that the basic structure of the program is so fundamentally flawed that the Secretary, I believe, does not have the authority to make such dramatic changes, and it will have to come back here. When we had the initial exposure to the Class Act concept, when Mr. Pallone brought it late that night when we were marking up H.R. 3200, I seem to recall at that time the discussion was the premium was set at $50 a month and the benefit was $50 a day. I get the impression it has morphed a little bit since then. Can you give us further insight as to what the likely premium is going to be? Well, there's nothing in the law that says what the premium must be. The thing that's what's specified is what the minimum benefit must be, $50 a day. Beyond that, it's a matter of actuarial science and guesswork, I'd say. Well, then I guess we better ask our actuary. I would, but I think the key point is that there's a huge difference of opinion between CBO and the chief actuary of CMS, which tells you how fundamentally uncertain this whole
And I think that's the point I was actually trying to make, but let's do hear from our actuary. You looked like you wanted to say
Sure. I think that
I want to empower you.
The current design is structured such that I think the premiums are going to be, they're going to be difficult to price with the current design because of the lack of risk classification and the actually rich type of benefits. This plan is a cash plan, and everybody likes cash. Cash is easy, cash is flexible, but cash is a very expensive way to pay long-term care insurance benefits. People claim earlier, they claim more often. You end up with what the private industry calls ADL creep, in that in order to qualify for benefits, you need assistance with your activities of daily living. Well, people will start to move towards claiming that earlier under a cash plan. You also have lifetime benefits in this plan. In lifetime benefits, there is significant adverse selection that the industry is well aware of that they experience on lifetime benefit plans. And so you have these very, very expensive features in a voluntary guaranteed issue program that put all together, with what's available in the competitive market, needs to all be taken into account in pricing this program. And it's a very difficult task the way the structure is currently designed.
Is it possible that the premium could increase under the class as written?
Yeah, I think it could. I think there's a risk of, if not pricing this right away, it's so important to take in all these considerations right away, because if you don't, you're going to start in a hole. And if we start in a hole, the thing is not going to, you're not going to be able to dig out, is going to be almost impossible. It's going to be very difficult to actually right the ship and either increase premiums or lower benefits.
Could you see premium increases as much as 60%?
Well, because of the volatility, all of the issues going on in this program, it's unknown what the premium increases might be. So.
Thank you. I yield back, Mr. Chairman.
Sure. Thanks, gentlemen. Recognize the ranking member emeritus, Mr. Dingell, for 5 minutes for question.
Mr. Chairman, I thank you for your courtesy. Mr. Minix, I want to thank you first for your kind words about me and my colleagues who have worked on this matter. I want you to know I intend to continue working with the administration and with other stakeholders to ensure that the program is successful. Mr. Minix, you note in your testimony that the Class Act will be of assistance to employers, particularly small businesses. Your testimony points out that MetLife estimated the cost of loss activity, or productivity, for employees to be $17 billion annually. I gather this is in good part due to employees having to take time off for care of older relatives. Am I correct in that?
Right.
Now, on the other hand, Mr. Warshawski, in your testimony, you note that the vast majority of employers do not subsidize or even offer long-term care insurance, partly due to the fact that they do not see offering such insurance as providing a significant business advantage. Is that correct?
That's correct.
Thank you. Now, you both discussed the impacts of Class Acts for employers. And I'd like you both, if you please, to respond to the following questions, and if you please, again, to answer yes or no. If not, and if you answer no, would you please, for the record, submit a detailed explanation to give us a more full picture of your concerns. Now, Mr. Minix and Mr. Warshawski, I've too often heard from adult constituents about financial difficulties of trying to care for their older relatives, mostly their parents, while trying to raise children of their own. Is it true that the Class Act allows payments to adult caregivers that would help offset the cost of the care they're providing? Yes or no?
Yes.
Yes.
Thank you, gentlemen. Mr. Minix and Mr. Warshawski, again, is it true that the availability of Class Act would allow adult caregivers to hire home care assistants to help in the daily care of their elder relatives? Yes or no?
Correct. Yes.
Mr. Warshawski? Now, Mr. Minix and Mr. Warshawski, by hiring these home care assistants to help with the daily care of elder relatives, wouldn't this help to reduce caregiver absenteeism in the workplace? Yes or no?
Yes.
Not to a significant amount.
Okay. Now, Mr. Minix and Mr. Warshawski again. In your opinion, then, if the Class Act will help to relieve the financial burden for adult caregivers and also reduce caregiver absenteeism from the workplace, do you believe that it would help the employers to see in their workforce greater productivity? Yes or no?
Yes.
No.
No?
No.
Okay. Now, Mr. Minix and Mr. Warshawski, is it not true that a more productive workforce would be a business advantage for employers? Yes or no?
Yes.
Yes.
Now, I'd like to look at this. We've looked at the cost of this to government and the possibility of failures, but we pay for health care for our people out of a lot of different pockets. On Medicaid, we pay for health care, particularly in the area of long-term care. And this is an enormous cost for the taxpayers. In that particular program, there is virtually no contribution made by the person who receives the help from this federal-state combined program. But with the program we're talking about here, we would find that the Class Act would allow persons, and in fact encourage them, to pay into the program. Would this not then ease somewhat the burden on Medicaid, which pays a huge amount of cost, and which largely pays cost for institutional care as opposed to home care? Isn't this going to help somewhat with regard to the cost of Medicaid, which is breaking state budgets, causing huge budget difficulties to the federal government?
Congressman, as I indicated in my written testimony, it's very unlikely that lower or even moderate income workers will purchase long-term care insurance because of the availability of Medicaid. There's been many very rigorous fine studies that have been done on this subject, and they indicate uniformly that that's.
So you don't think that would be an effect?
I think it would be extremely minimal. Yes.
Mr. Minix, yes or no?
Have the opposite view.
Thank you, Mr. Chairman. You've been courteous. Thank you.
Chair, thanks, gentlemen, and recognizes Dr. Cassidy for 5 minutes for questioning.
To all of you whom I question, I apologize. I had to step out of the room, so if it's a repeat question, I'm sorry. I just say that. Mr. Schmitz, our folks on the other side of the aisle kept on saying how this is a solution, but I think what I'm hearing is that if by statute they have to make it work, meaning they have to increase the premium so that it's actuarially sound, that the way you write, how I think I have a quote here, based upon this analysis, it was concluded that the program would not be sustainable in the long term, and it is unlikely to cover more than a small proportion of the intended population. Not much of a solution. That said, it also seems as if it would cover even a smaller portion if there is adverse selection, and I think the Assistant Secretary, her absence of comment upon my question kind of affirmed my answer, right, that there would be a great potential for that adverse selection. Can we imagine what would be the uptake of a product, insurance product, if the monthly premiums are $240 for a benefit that will be accrued when you're 30 years older?
Yeah, I think the uptake. It's going to really depend. The way it's currently structured right now, and those higher premium levels will likely have very low participation. There needs to be the structure of the program as it is right now with on a guaranteed issue voluntary basis is going to be very expensive.
Now, when you say very expensive, it could be $3,000-4,000 a year, correct?
Yeah, I mean, you end up with a situation trying to deal with the premium spiral in that, well, if the more you raise premiums, the less the healthy individuals will keep leaving. and so then you have to keep raising premiums. And so you get to a point where eventually you're just going to be having prepaid care. And so without having risk classification in the program, that is going to be adequate to get the participation from healthy individuals that you need, the premium rate spiral potentially will make it unsustainable in the long term.
Mr. Warshaw, Mr. Minix, Mr. Dingell asked you all a question just now, and you said, no, you didn't think it would have much of an impact. I think it was about the ability of this payment to offset Medicaid costs. Was that the question that y'all differed on? No, go ahead, continue. Now, you quoted data. You said there's multiple studies showing it will not have an impact. Now, Mr. Minix, you disagreed with Mr. Warshaw. Do you similarly have data, or is that just the feeling that you have?
No, we're going on what the CBO said in their scoring. We also did a...
Now, what specifically did the CBO say that you would base that on? Because what I was reading is that it's going to be actuarially unsound in a decade or so.
What the CBO data said, I get the specific figure, but I think it's a matter of public record, is beginning the 6th or 7th year out, it begins to show Medicaid savings.
Now, the $2 billion Medicaid savings that Mr. Waxman quoted earlier, I tried to look up the number for our national debt for long-term care and Medicaid program. It's huge. And by Deloitte & Touche, they did an analysis, or Deloitte, they were saying that it's going to be like 35%, I don't have the article in front of me, of New York's budget. So $2 billion over the entire nation, well, it's a lot of money in absolute terms. As a percent, doesn't sound like very much to me.
Well, you can take it from a conservative standpoint and say...
I like that.
And say that if there's minimal participation, that's all it saves. A study we commissioned independently that I'll be glad to share with you says that if everyone eligible participated in a similar kind of program. You got to remember there are different assumptions.
That would have to be mandated, right? But if you took, when you say everyone,
I'm not talking about the political mandate. I'm talking about everybody's talking theory here.
No, because actually the thing I'm after is Mr. Warshaw is quoting data, and I think Dr. Antos.
I'm trying to respond. I've got data.
But they say 2 to 4%. Are you saying there'll be 100%?
I'm saying that we commissioned a study that shows that if there were 100% of the participation studying, that the Medicaid savings, if a plan like this were in place today, Medicaid for long-term care would be...
Okay, I'm sorry, I'm almost out of time. Dr. Antos...
$50 billion savings.
Do you think it's reasonable, based upon any empiric experience, that we would have 100% uptake in a voluntary program like this?
None whatsoever.
And what do you think that either?
But that's what your study shows. And so what do you think would be more likely, Dr. Antos?
Well, it's hard to argue with the people who've done the estimates so far, and they think that the take-up rate for the total population, not the employed population, will run 2 to 3.5%.
Thank you all very much.
We think it will be significantly more than that over time.
Chair, thanks, gentlemen, and recognize the gentlelady from Illinois, Ms. Schakowsky, for 5 minutes for questions.
Well, first of all, after sitting here, not through all the testimony, but through this hearing and others like it, I have to question the intention of this hearing. Everyone on the other side of the aisle, on the Republican side of the aisle, has voted, it seems like dozens of times, to simply repeal the Affordable Care Act and the Class Act with it. So I think this is just another effort to try and set up a panel that, aside from our two witnesses, Mr. Minnick and Mr. Young, to discredit this program. I was on the President's Commission on Fiscal Responsibility and Reform, and I started that by saying, you know, it'd be pretty easy to balance the budget. You put on your green eye shade, you bring in the actuaries, and a red pencil, and you just cut. But that's not who we are as Americans. And today we're talking about a program that is designed to not cost $1 single of taxpayer funding. And we're finding out that, hidden in there is going to be some sort of addition to the deficit reduction. Now, I would be happy to sit down with actuaries and experts on all the research and design a real program if you don't like what's going on. But that's not what we're talking about. This is an effort to discredit a program that we think, by and large, perhaps with some important improvements, could help people. Now, I want to talk a little bit about money, Mr. Young. You used to be getting federal support, right? SSDI. But you aren't anymore. You're now working, paying taxes, and contributing. I don't know how much you're reducing the deficit by with your income taxes, but it's something. Yes. So creating a program, I guess my question is, how will this help people work as opposed to even have to get long-term care insurance or, according to the naysayers, be on the public dole?
Well, if you can't get out of bed in the morning and you can't get dressed and you can't have supports at work where, you know, if you need to go to the bathroom or have a drink of water, you can't work. That's the bottom line. If there are no supports available for basic bodily needs, nobody's going to be thinking about how to go to work or even being in the workforce because you're worried about basic survival.
So you think that this kind of program available to persons with disabilities could actually put make more people as taxpayers as opposed to tax eaters.
Right, exactly. And the fact that it's lifelong and it doesn't disappear once you go to work and start earning some money, like Medicaid supports do, is invaluable.
Mr. Minnick, this notion of this tiny number of people that's projected to get this insurance, I think first assumes that people would rather spend down into total poverty in order to get on Medicaid as opposed to take care of themselves, personal responsibility. But as you said, it will take an education program. Why do you think that there will be more than this minuscule number that they're projecting that would actually enroll in this program?
I've been serving people in this field for 38 years. I've seen a little bit of everything. And one of the things you see over and over again is, number one, families' willingness to bear responsibility for their loved ones. And secondly, they begin to run out of money doing it. And the sandwich generation in the middle begins to say, do I help my children or grandchildren, or do I pay for elderly relatives? And there's no program there to do it. And the work we've done with focus groups and polls and other things say the American public is ready to look at this issue. We've talked to younger people, older people, and middle-aged people, and they say, yeah, that's beginning to make sense, and I'd be willing to pay. So I'm looking forward to the day Assistant Secretary Greenlee rolls out this plan, and we see who salutes. And I'm betting it's going to be more than 2 or 3% of the people.
But you're not just waiting, I would hope.
No.
Can you talk to us about what kind of efforts you see to educate people and to make sure that they know about it, et cetera?
Well, the Advanced Class Inc. board, which is made up of some leaders of the 270 Coalition, we've set up shop. We've got a website. We're beginning to get the word out, and just things like this will be a huge education effort so people can talk about it and begin to plan for it. We're determined to get people to plan for it.
Is the disability community going to do that as well, get the word out?
Yep. We're together in this.
Chair, thanks to the gentlelady's time has expired. Chair recognizes the gentleman from Georgia, Dr. Gangry, for 5 minutes of questions.
Mr. Chairman, thank you, and I'm going to read in sort of in response to my colleague from Illinois, from the Debt and Deficit Commission, the National Commission on Fiscal Responsibility and Reform, the official title of their report in December of 2010, of which Ms. Schakowsky was a member. So I'm sure she knows exactly what's in here. But here's what they say in regard to the Class Act.
And you know it wasn't adopted. Excuse me.
Reclaiming my time, the Community Living Assistance Services and Support, the Class Act, established a volunteer long-term care insurance program and acted as part of the Affordable Care Act, Obamacare. The program attempts to address an important public policy concern, the need for non-institutional long-term care. But it is viewed by many experts as financially unsound. The program's earliest beneficiaries will pay modest premiums for only a few years and receive benefits many times larger, so that sustaining the system over time will require increasing premiums and reducing benefits to the point the program is neither appealing to potential customers nor able to accomplish its stated function. Absent reform, the program is therefore likely to require large general revenue transfers or else collapse under its own weight, Commission advises the Class Act be reformed in a way that makes it credibly sustainable over the long term. To the extent this is not possible, we advise it to be repealed. Technically, repealing the Class Act will increase the deficit over the next decade because the program's premiums are collected up front and its benefits are not paid out for 5 years. To address this, we would replace the deficit reduction on paper from the Class Act with real options that truly save the federal government money and put it on a more sustainable path. Let me ask Mr. Antos, have you seen the CRS memo that I submitted earlier for the record when I was with the first panel with the Secretary? Have you seen that? And does it states that the Secretary does not have the authority to change income eligibility?
Yes, I have looked at that. I'm merely an economist, not a lawyer, so I'm not qualified to really opine on this. But I believe that CRS has experts in the law who can make this judgment. If this is in fact the case, then it seems unlikely to me that this program can be put on a actuarially sound basis.
Well, then it's your opinion, Mr. Antos, I think I understand you correctly, that if the Secretary does not have the authority and the language in the law to make those necessary changes that the first witness said were absolutely essential to put it on a sustainable glide path, if we can't fix it, do you think that we should repeal it as the President's commission, of which Ms. Schakowsky was a member, recommended?
Well, I think we should deal with the problem. I think that's the problem with this law. It doesn't deal with the actual problem. Mr. Young is a great person who's somehow managed to survive our system. This Class Act really doesn't address it, and to have a program that is going to fail with certainty and going to make false promises that can't be kept is a disservice to disabled people.
Well, and I thank you for that, and of course that is my concern, and that's why I bring up these points. And in the minute that I have remaining, I would like Mr. Schmidt to ask you, under the law, any individual whose income does not exceed the poverty line, and any individual who has not obtained age 22 is actively employed and is a full-time student will pay a nominal premium beginning at $5. What do you believe will happen to the program's sustainability if more low-income individuals enroll at the $5 premium subsidy than it's actually projected in the bill?
Yeah, if we end up having more people in the program at the $5 subsidy, it's the other individuals who are going to have to subsidize them, and their premium rates are necessarily going to be higher. It's going to be important to try to understand and estimate those numbers of how many people we will be subsidizing, and that's one of the challenges in pricing this plan, is being able to predict that level of adverse selection. There's a lot of unknowns and a lot of assumptions that need to be nailed down in this plan that are pretty volatile to predict.
I wanted to pursue it further, Mr. Chairman. I see my time has expired, and of course I yield back.
The gentleman's time has expired. Chair thanks the gentleman. And this has been excellent testimony, excellent panel. In conclusion, I would like to thank the witnesses, thank the members for participating in today's hearing. I remind members they have 10 business days to submit questions for the record. I'd like to ask the witnesses to respond promptly to any questions that are given to you in writing. Thank you. Members should submit their questions by the close of business on March 31st. The subcommittee is now adjourned.